It was a release. You know what I'm saying?
All right. We're back on the record now. This is the matter of Roosevelt. I think it's Roosevelt versus Sotomayor. Roosevelt et al. Versus Sotomayor, 14 CI 0001. Day one of the jury trial in this matter. We're outside the presence of the jury, or we're in the presence of the jury, actually. Less one, right?
One of the jurors isn't present?
One of our jurors isn't present. Well, gosh. Our jurors, he doesn't understand. I keep a trial on track, you know? Yeah.
He's in the restroom.
I had a lawyer tell me that. He said, well, gosh, you got to wait for the jurors,
Feel free
you
to go
know?
check.
Well, I'll tell you what, that was outstanding. I've got a pain, Dr. Scalia, in my side, and I want to talk to you about that after. I was impressed. I was like, man, is this guy a real doctor? That was good. Excellent, excellent, not good, excellent.
He was well prepared.
Yeah, well,
it was teamwork.
I've already told him that. Yeah, tape is rolling. Tape is rolling. I've already told your professor that. I've had a lot of doctors on the stand, and I tell you what, I was forgetting that you weren't a doctor. I'm serious. I was like, my back is hurting. I'm gonna talk to this guy. Welcome back, ladies and gentlemen of the jury. We are on the record. This is the matter of Roosevelt et al. Versus Sotomayor et al. Day one of the jury trial in this matter. We are now in the presence of the jury, ready to continue this trial. Who is the next witness on behalf of the plaintiff?
Your Honor, may I approach?
You may.
Your Honor, I move to admit these two exhibits marked Plaintiff's Exhibit 1 and Plaintiff's Exhibit 2 that have already been identified by our witness.
Excellent.
Thank you.
Is there any objection to the admission of Plaintiff's Exhibit 1 and 2?
No, Your Honor.
Exhibits, plural. If you wouldn't mind, they're admitted, and if you wouldn't mind, just put them in that cubby hole right there, right in front of the witness stand there. You know that little area there? Yeah, what I'm calling a cubby hole is, they get it up here, I lose it. Who is the next witness on behalf of the plaintiff?
I would like to call Carrie Roosevelt to the stand, please.
All right, Roosevelt. Ms. Roosevelt, if you would please approach the witness stand before you're seated, if you'll please raise your right hand. All right. You swear affirm testimony you're about to give will be the truth, the whole truth, nothing but the truth, so help you God.
I do.
All right, please have a seat there. Please keep your voice up for the purpose of the record, the hearing of the jury and the court. Miss Carey, you may proceed.
Would you please state your name for the jury?
Carrie Roosevelt.
Okay, and what is your job?
I'm a nurse.
Okay, and can you explain what your relationship is to the plaintiff?
The plaintiff is my mom.
Okay, and can you describe the relationship you have with your mother, Evelyn?
We had a really good relationship. I actually lived on her property for 40 years, so a better than average mother-son relationship.
Okay, and how often did you see your mother?
I saw her every day.
Okay, and in your personal opinion, was your mother healthy?
Oh, absolutely. She was the kind of woman who didn't go to the hospital for every little ache and pain. She kind of tried to take care of herself. In fact, I can only really remember her going to the hospital for like kidney stones and childbirth.
Okay. Mr. Roosevelt, I'm going to ask you some questions about the night that your mother went to the hospital in November 2001. Can you tell us a little bit about that night?
Well, I was at home by myself, and I got a phone call from my mom. She said that she was really worried because the pain she was having in her chest were close together in time, and so she was going to go to the hospital.
Okay, and did you meet them there?
Meet them where?
At the hospital.
No, I actually met her at her house, and then she drove my sister Jessie and her to the hospital, and then I followed along behind them.
Okay, so who drove your mother to the hospital?
She drove herself.
Okay, and about how far is it from where your mother lives to the hospital?
It's about 18 miles.
Okay, and can you tell us what happened when you got to the hospital?
As soon as we got to the hospital, we walked in. She gave her purse to my sister, and we went into the emergency room, and then an intake nurse took my mom out of the room.
Okay, when you arrived at the hospital, though, your mother had all of her mental faculties. Is that right?
Oh, yeah. She drove herself, so yeah.
Okay, so she was cognizant.
Yeah.
Objection, leading.
Withdrawn.
Okay.
On that day, did your mother appear to have her memory?
She did.
Okay. And what happened after your mother was taken by the triage nurse?
So she came out with the triage nurse, and we went to the emergency room. We didn't really know where we were going. A nurse told us where to go, so we all went into the room, and then doctor came in, and he started doing like a history and physical, I think is what they called it, and he started pushing around on her. He got to like a point on her chest where she kind of sighed, and I think it hurt her. He asked what was going on, you know, if that was what hurt her, and then he ordered an EKG.
Okay, and did you speak with Dr. Smith personally?
There were two Dr. Smiths.
The one who ordered the EKG?
No. Mm-mm.
Okay, can you tell us when you were first notified that your mother was going to have surgery?
Okay, so that was the night, and then I left. I left because I had to go to work, and so the next day my sister called and said that she was going to have a test done, but not the surgery. And so my sister called and said there was going to be the test, and I didn't go back because it was just a test. That was not a big deal. And then I think it was the next day that they called and said, I'm sorry, it gets fuzzy, but they called and said that they were actually going to do gallbladder surgery.
Okay, so they told you they were going to do gallbladder surgery.
They did.
Did you inform whoever it was you spoke on the phone with that your mother didn't have a gallbladder anymore?
Well, it was my sister who called me, and no, I didn't tell her.
Okay, why?
Well, when she called me, I was at work because I'd already left because they told me that she was just going to have a test. And so I knew I had to leave work, and I knew I had to get to the hospital. I'm a nurse, so I couldn't just walk out. I had to find someone to take my spot. So as soon as she said, my mom's having surgery, I didn't even think gallbladder. I just thought, oh my gosh, I've got to get there to my mom.
Okay, did you get your shift covered?
Yeah, but it took like 2 hours to find someone to cover me.
Did you make it to the hospital before your mother went into surgery?
Before, no.
Did you have the opportunity to speak with anybody prior to her going into surgery, the doctor, your sister?
I didn't talk to anyone once my sister initially called me and said, Mom's having surgery. And I said, okay, I'll be there as soon as I can. And I didn't talk to anybody else.
Okay, what about after the surgery?
Yeah, after the surgery, I talked to Dr. Sotomayor.
Okay, and what did he tell you?
That they went in to do surgery and that their test had shown that they thought there was a gallbladder. When they got there wasn't a gallbladder in there.
Okay, and then what happened?
Well, then I said, yeah, I know that.
Okay, and what did he say in response to you when you said that?
Said it sure would have been nice to know that.
Objection, hearsay.
Sustained.
Okay, did Dr. Sotomayor explain what happened?
He did. Yeah, he did. He came in and he said that they did a surgery. They opened her up, and that when they got in there was staples where a gallbladder used to be.
Okay, did he tell you why he proceeded with the surgery?
I don't remember that. Maybe that they had done tests. I don't remember.
Did you say anything else to Dr. Sotomayor?
Yeah, I talked to him a little bit about future complications. My mom was 75, so I asked what's the next step. And I don't remember exactly what the question was, and I don't really remember how he answered that.
Okay, how long did you stay with your mother after the surgery?
I didn't really leave after the surgery. I stayed overnight. I was really worried about her and her condition. Anytime you leave, you could get bad news, and I didn't want to have to go through that situation again of the rush, the anxiety, missing an opportunity to talk to a doctor. So I stayed there pretty much until it was over.
Okay, and what's your personal opinion about the sudden decline in your mother's health following the surgery?
Well, like I told you, she was healthy. She drove herself there. She was healthy. And if they would have looked and seen the records that showed she didn't have a gallbladder, she was older. She was 75 years old. Just asking her wasn't enough. They should have looked at what the records showed. And if the records showed that her gallbladder wasn't there, it was an unnecessary surgery, and I think my mom would still be here.
No further questions.
All right, thank you very much. Is it Miss Carey?
Carrie.
Carrick.
C-A-R-E-K.
See, I knew I had it wrong.
That's okay.
I knew it. Ms. Carrick, nice job. Is there going to be cross?
Yes,
All right.
Shayla Bush.
Miss Bush, go right ahead. I'm getting a bit confused. It's two Miss Bush.
Good morning, Ms. Roosevelt.
Hi.
First and foremost, I want to tell you my condolences for your loss.
Thank you.
I'm just going to start off by asking you a couple of questions. Is that okay?
Absolutely.
Your mother is Evelyn Roosevelt, correct?
Correct.
And where did you live in 2001?
Well, for part of 2001, I lived on her property.
Specifically where?
Within walking distance of her house.
In her backyard?
Sure.
And how long would you say you've lived there?
I lived there for about 40 years.
Were you financially dependent upon your mother?
I held a job. I wouldn't say dependent. She helped me out like a normal mom helps out their kids.
For 41 years?
She helped out all of us. I have a lot of sisters and brothers.
All right. And would you say, with you being that close to your mom, that you were aware of her medical history?
To some extent, maybe. I did have, yeah, sure.
You had knowledge of some medications she was on?
Sure, mm-hmm.
You had knowledge of some previous surgeries?
Yeah, mm-hmm, I did.
And you're employed as a nurse, correct?
I am now, yes.
You were for 12 years, right?
12 years, mm-hmm.
Okay, so you're familiar with some of the medical terminology that's being presented today, correct?
Yep.
Okay. And throughout your experience in that area, nursing, is it your understanding that complications may arise from surgeries?
Yeah, there are complications from every surgery.
Specifically gallbladder surgeries?
I can't say as a nurse whether there's more complications from gallbladder or not. I can't speak for all nurses.
But just to clarify, you said that complications can arise from any surgery.
Sure.
Thank you. Speaking of, you were aware that your mom had her gallbladder removed in 1991, is that correct?
Yes.
Right. So you were aware of this before she was hospitalized?
Yes.
All right. And let's discuss the events that led up to your mom's hospitalization. You said she drove herself, correct?
She did?
So would you say she was cognizant and alert and able to move on her own?
Absolutely.
And you said that your mother never really went to the hospital, am I correct?
She had kidney stones that she went for, and I think, and birth.
But overall, you said she never really went, correct?
Other than those 2 times that I recall.
So she never really went to the hospital?
That's
I
an
can't.
answer, Your Honor.
I'm trying to
Overruled.
get a clear answer for this
All
question.
right. It's overruled. You may ask a question.
just
I
need to
can
get
say
to
that. Can you repeat the question?
Yes. Would you say that your mom does not go to the hospital often for pain?
My mom went to the hospital for kidney stones and for birth.
I'm going to ask the question one more time, and I just need a simple yes or no, please. Would you say that your mom goes to the hospital often for pain?
Not often.
She went to the hospital this time in 2001 for her pain, right?
Yes.
So would you say that was pretty urgent?
I can't clarify urgent. I don't know.
But it was not normal that she would go for pain.
It was not normal, correct?
So this meant that it had to be significant pain for her to go to the hospital, correct?
On whose standard? On my mom's
Your
standard?
mom's standard.
Yeah. Mhm.
Thank you. So you left the hospital after the first couple of days, correct?
I did. I went back to work.
And how were you informed about the gallbladder surgery?
My sister called me.
And she called you prior to the surgery?
Right. I testified that we thought mom was going to have a test, and then they changed it really quickly to a surgery.
Right. And you were aware that your mom had gallbladder surgery in 1991?
Yes, I've testified to that.
Did you inform your sister?
No, like I said, I was in the middle of work, and my first thought was, I've got to get to the hospital. I did not tell my sister at that point.
So you did talk to another sister before the surgery, correct, too?
Before the surgery.
Yes. prior to the surgery, you had contact with one sibling that called, and then you talked to another sibling? Do you need your deposition to refresh
I
your
have
memory?
multiple sisters, and
Do you need your deposition?
yes, if you don't mind.
Your Honor, may I approach the witness?
You may.
Show her deposition. Can you read line 18 on page 22?
Absolutely. Question: before surgery, did you speak with Jesse? Yes.
Thank you. So you had 2 occasions where you could have informed your siblings that your mom had her gallbladder removed. And that would be a yes or no.
No, Jesse called me. That's when I talked to Jesse.
You talked to her prior to the surgery, correct?
She called me to tell me there was the surgery. I was at work. That's when I talked to Jesse.
Prior to the surgery, correct?
Yes,
So before
yes.
the surgery began?
Yes.
So you had 2 opportunities to inform your siblings?
No. I'm sorry. Let me clarify. My sister Jessie called me to tell me that that Mom was getting it changed to surgery.
And this was prior to surgery?
And that was it. And then when I got there, they were already in surgery.
But you did have the opportunity to tell them both?
Yeah. One sister, Jessie.
But you also talked to Janice, who called to tell you that your mom was having surgery, correct?
Oh, wait. I'm sorry. Yes, I thought Jessie called me. Jessie passed away, and so I thought that it was Jessie.
It's okay. But there was 2 opportunities.
2 sisters. Yes.
2 opportunities.
Yes.
Thank you. And the time that you actually acknowledged that you knew was after the fact when the doctor came and informed you that the surgery was over?
Then I knew what?
That your mom had her gallbladder removed in 1991?
When he said it was when I thought it clicked. As soon as he said it, that's when I was like, oh my gosh, she had her surgery.
And it is your belief that this surgery was unnecessary, correct?
Absolutely. It was unnecessary. She already had her gallbladder taken out. Why would she
All
need
right,
another one?
Ms. Roosevelt, for my final question, I just need a simple yes or no. Do you believe that if you were to inform your sisters of the gallbladder surgery prior to the surgery, that this could have stopped the surgery from occurring?
If I would have said something?
Yes, ma'am.
Sure.
Is that a yes?
Yes.
Thank you. No further questions.
All right, thank you very much, Ms. Bush. Any redirect? Ms. Carrick? Yes?
Yes, Your Honor.
All right.
We've changed our mind.
Very good. You may question.
Okay, Carrie, can you just explain the capacity you were in when you went to the hospital with your mother?
Which time?
When she went in originally to the emergency room.
Well, when we first went in there, it was scary to begin with because she doesn't go, and so I was like, and it was chest pains, so I was really anxious at that point.
Okay, so did you go as a concerned child or in your capacity as a nurse?
Oh no, as a child, absolutely as a child.
No further questions.
All right. On that basis, anything further? Ms. Bush, do you have additional questions?
No, I'm
All right.
complete.
Ms. Roosevelt.
Roosevelt.
Yes, you may step down.
You can stay right there.
Oh,
You can stay right
okay.
there.
Is she going to question?
Your Honor,
You got
at
a
this
question
point in
now?
time, we would like to read into evidence excerpts from the deposition of Jessie Roosevelt, the dead daughter. This deposition was taken back on July of 2004, back in July of 2004.
Okay, very good. Is there any objection to that?
No, Your Honor, it's
All right.
within the rules that they can bring the deposition in.
Excellent. Go right ahead.
No, you're fine.
Deposition
Now approach.
of, you may. Is that my copy? It's the only copy. Oh, it's the only copy. Okay, you go right ahead. Jessie Roosevelt. There you are.
Okay. Stack 96. Question. Your mother, again, was she alert, and just for the jury, this is the deposition that Jessie Roosevelt gave to the defense attorneys. They were present, there was a reporter present, she took everything down. She swore to tell the truth, the whole truth, and nothing but the truth, just as everyone has done here today. And she gave this deposition under penalty of perjury, okay? Just so we all understand that this deposition has some force.
Okay, you would never be able to do that. That is a sua sponte objection sustained. Don't ever, ever, ever talk to my jury, and don't ever make an argument, and don't ever tell them how to interpret something. If you want to tell them, you tell me, and then I'll tell them. You see what I'm
Your
saying?
Honor, would you please inform the jury what this deposition is?
Okay.
And then-
I just had to do it. It was I wanted to I just wanted to see it. I had to let it out.
No, let me ask.
It's one of my points. I mean, you just can't. Don't talk to
Your
the
Honor, I
jury.
promise I'll never
It's
make
just something that I
I can
don't.
assure you,
It's a
we'll
pet
never do it
peeve.
again.
Yeah.
Definitely
Just
never do
not- So what would you like me to say to the jury?
Your Honor,
And we're on the noise right now.
Your
Let's
Honor.
pretend.
Yeah, it would be nice, and we would appreciate it if you would inform the jury that this is a discovery deposition from Jessie Roosevelt, and that she gave this deposition under oath, just as everyone here is sworn to tell the truth, the whole truth. and
Thank
nothing
you.
but the truth.
Yeah, excellent. And that's what we would normally do. It's, this is a deposition. We're going to read in this deposition. You accept this testimony as you would live testimony here in court. Give it the same weight. Mr. O'Brien,
Thank
go
you,
right
Your
ahead.
Honor.
Is
Just a
there an
really quick
objection?
objection, Your Honor. I think it's fine that counsel reads the deposition, but I don't feel that the witness can actually answer these questions since she has a lack of
I'm
personal
sorry.
knowledge to answer those questions.
I'm an attorney right now. I forgot to put my attorney hat
Oh,
back
okay.
on.
You're
Give
just
me-
reading the
Oh,
deposition?
I'm just reading the
Just
deposition
reading
as
it
the
back.
attorney.
That's all there is. Yeah.
Sorry.
It's good.
Character
It's good.
switch.
It's good. We're all good. I got it.
Different hat.
All right. Fantastic. Go right ahead. Reading of the deposition.
Question. Your mother, again, was she alert and oriented on this date?
Answer, I don't recall if she was oriented, but they had given her something for this procedure that they thought they were going to do, that I thought they were going to do. I was sitting out in the waiting room.
Question. Do you recall Dr. Sotomayor discussing with you and your mother the possibility of a gallbladder removal?
Answer, yes. When he told me that my mother and he had decided I was in the room where they do, she was on the stretcher, to go ahead with the gallbladder surgery. And I thought to myself, that's strange, that's awful fast. He doesn't have her records, I thought. And then I thought, well, with computers and faxes, it is possible that he got them. I don't know. But he talked to Dr. Thomas. I don't know.
Question. So you weren't in the room with your mother when this was decided between her and Dr. Sotomayor to have the gallbladder?
Answer, no, not when it was decided, no. I was out in the waiting room. He came and got me and told me they decided.
Question. Did Dr. Sotomayor explain the gallbladder removal procedure, which is a laparoscopic cholecystectomy? Was this procedure ever described to you and your mother by Dr. Sotomayor?
Answer, he may have described it to my mother, but he did not describe it to me.
Question. So you weren't in the room with Dr. Sotomayor when he was describing this to your mother?
Answer, no.
Question. Do you recall Dr. Sotomayor ever asking either you or your mother, asking either your mother or yourself if your mother had ever had any previous surgeries?
Answer, no.
Question. Do you know, sitting here today, whether or not Dr. Sotomayor discussed with your mother whether or not she had had any previous surgeries?
Answer, I don't know.
Stack 100. Question. And what did Dr. Sotomayor tell you?
Answer, he told us the surgery went fine except there was one problem. Her gallbladder had been removed before.
Question. Did this surprise you?
Answer, yes it did.
Question. And why is that?
Answer, because I told Dr. Thomas that she may have had her gallbladder removed already, that he would have had to check her records.
Question. Did you ever tell Dr. Sotomayor that her gallbladder may have been removed?
Answer, no.
Question. Do you have any particular criticisms regarding the treatment provided to your mother by Dr. Sidney Sotomayor?
Answer, I think he should have got with Dr. Thomas, her primary physician, before he started the procedures and checked her records from all angels like I told Dr. Thomas. He made a statement that he didn't want to have to go home and come back. That's why he went ahead and did it.
Question. That's why he did what?
That's why he went ahead and performed the surgery, because he just didn't want to have to come back to the hospital.
Question. Would that have been the gallbladder surgery on the 8th?
Answer, gallbladder.
Question. Is it your understanding that's why he performed it on that day, because he didn't want to come back? Is that what he told you?
Answer, that's what I understand.
Question. Was there ever any discussion about having the procedure done on a separate day?
Answer, no. Actually, she was just supposed to have the bronchoscopy done that day, and then all of a sudden it was changed.
Question. Did Dr. Sotomayor or any other physician tell you that it was emergent or urgent that your mother have the procedure on November 8th?
Answer, no.
Question. When did you find out that she was not going to have the bronchoscopy or the endoscopy?
Answer, when Dr. Sotomayor came and got me, that's when I was kind of leery, but I didn't say anything because, like I said, with computers and faxes, I thought maybe they had already obtained the records and he has already talked to Dr. Thomas.
Stockman allowed. Question. Did Dr. Sotomayor tell you about why he did not want to wait to do the surgery?
Answer, he said he was on the floor at the time and couldn't see going home and coming back. He was waiting on the radiology reports to come in, and once received, he canceled the other tests which would have ruled out the gallbladder.
Question. What did Dr. Sotomayor tell you when you asked him about the medical records?
Answer, Dr. Sotomayor stated, we don't go by medical records, we go by what patient says.
Question. When Dr. Sotomayor explained why he did the surgery, what did he say?
Answer, Dr. Sotomayor stated he personally canceled the test that was to be done and decided to take her in and do gallbladder removal. Quote, after all, she's the last person of the day, and that means I would have had to come back. He further stated, quote, she is the last patient of the day, and I couldn't see any point in having to come back later, end quote.
Question. Did he say anything else?
Answer, he argued with us over going by patient rather than records.
Question. Did you ask Dr. Sotomayor any other questions, and what was his response?
Answer, we asked him, why would you start a procedure like this on your own without checking with someone else? And he said it wasn't necessary, I just saw that something needed to be done.
Question. After the second surgery, the exploratory surgery, what were you told and by whom?
Answer, Doctors Sotomayor and Thomas came out to the waiting room and said they were truly sorry.
Question. Was anything else said?
Answer, he said that my mom had complications due to an unnecessary surgery, that she suffered due to complications of an unnecessary surgery.
Who stated that this surgery was unnecessary?
Answer, Dr. Sotomayor.
All right, thank you very much. Who is the next witness on behalf of the plaintiff?
Your Honor, with your permission, I would like to just reread one of the questions that counsel has already read to the jury.
All right. Is this from the deposition?
Yes, this is
All right.
also from Jesse Roosevelt's deposition.
Your Honor, we object
Reread
to
it?
this. She just admitted that this question has already been read into evidence.
Yeah, did you use the word reread?
The probative value of rereading this question outweighs its prejudicial effect.
Your Honor, the jury's already heard the question and the answer.
Hold on.
We've heard a lot.
One of the points that I make is one objection, one person objects at a time. And Ms. Bush has risen to object, and she's done so very well. She's done a nice job. The objection is that it is
Repetitive. It's already been asked and answered. It's already on the record. Your
yes.
Honor.
I'm going to sustain the objection. It's reread. That's the word
Okay.
you used, right?
Okay.
Sustained.
Thank you, Your Honor.
All right. Who's the next witness on behalf of the plaintiff?
Plaintiff's rest, Your Honor.
All right. Very good, ladies and gentlemen. The jury, plaintiff's rest this case. Do we have any motions by the defense? Anything? Nothing? It's overruled anyway. At this point, at this point, you make a motion for directed verdict, I'll overrule it, and then we'll go forward. So that's what happened. It happened already. It just happened just like that. All right, so I'm going to turn to the defense, and who's the first witness on behalf of the defendants in this case?
Your Honor, the first witness for the defense will be Dr. Ginsburg.
All right, Dr. Ginsburg, if you would, please assume the witness stand. Before you're seated, Dr. Ginsburg, if you'll please raise your right hand. You swear or affirm testimony you're about to give will be the truth, the whole truth, and nothing but the truth, so help you God.
I do.
All right. Have a seat there, Dr. Ginsburg. Please keep your voice up for the purpose of the record, for the hearing of the jury in the court. Miss, once again,
My name is Katie Ball, Your Honor.
Miss Ball.
Yes.
Miss Ball, you may proceed.
Dr. Ginsburg, can you please state your name and business address for the record?
Yes, Bader Ginsburg, 4224 Main Boulevard, in Justice.
Okay, thank you. And we are deposing you in this case because you were a member of the panel that decided this case, correct?
Yes.
And what is your area of expertise?
General surgeon. I also do a little bit of family medicine, but primarily general surgeon.
And where are you employed?
I'm in private practice, but I'm also on call at St. Jefferson Hospital, and I'm on staff at Marsh Regional.
And do you know Dr. Sotomayor?
Yes, we trained together at University Hospital. It was around the same time in the same program. She might have been a couple of years ahead of me, 1 or 2, but...
And Doctor, I'm going to start getting into the details of Dr. Sotomayor's treatment of Evelyn Roosevelt. During this questioning between you and I may ask for your opinion, and that opinion will be based on your education, training, and experience. There is an implied part of my question, which is to a reasonable degree of medical certainty. And do you agree to only answer questions when I ask for your opinion to a reasonable degree of medical certainty?
Yes.
Thank you. And Doctor, did you review any depositions, records, or anything else before coming to court today?
I went over the panel review and the documents that support it with it, as well as the ultrasound report.
And Doctor, I'm going to ask you some specific questions about the panel's finding. Do you have a copy of that opinion with you?
No, I do not.
Your Honor, I would like to mark as an exhibit the panel's opinion in this case.
All
It
right.
will be defense's exhibit number 1.
Okay.
I have a pen. And I actually have a copy for my opposing counsel if you don't have it handy.
We do have it.
Okay, thank you.
All right. Good.
Here is that opinion.
Thank you.
Can I leave it with the witness, Your Honor?
You may.
Okay, thank you. And Dr. Ginsburg, before this case, had you ever served on a panel before?
Yes, I have around 30 to 40 times.
And are there any difficulties in deciding these cases in retrospect, so after the injury has occurred?
Yes, I would say it's hard because it's difficult for me to say what I would have done at that certain time.
And what did the panel find in this case?
We were unanimous in favor of Dr. Sotomayor.
And how many members were on this panel?
There are 4 of us.
And can you list those 4 members?
Yes, the attorney chairperson was Sandra Day O'Connor, and the other 2 members besides myself were 2 radiologists, Samuel Alito and Stephen Breyer.
And were those radiologists experts in their fields?
Yes, they were.
Thank you. And so all 4 members of the panel found that Dr. Sotomayor was within the standard of care in her treatment of Evelyn Roosevelt.
Yes, that is correct.
And what was the panel's first finding as to Dr. Sotomayor?
Our first finding was that the clinical impression of cholecystitis was bolstered by the ultrasound report, and therefore it resulted in an appropriate recommendation for surgery.
Okay. And can you tell me about the panel's reasoning behind this finding?
Well, Dr. Sotomayor, she had the clinical impression of cholecystitis, which is inflammation of the gallbladder. From there, she reviewed the ultrasound report, which is the gold standard. That helped support her clinical diagnosis because the ultrasound report stated that there was an abnormal gallbladder that was contracted, possibly, with possibly some shadowy stones present. And so therefore she relied upon her clinical diagnosis with the ultrasound report.
And Doctor, just to kind of get a reminder out here, what is cholecystitis?
It's the inflammation of the gallbladder.
And what is the surgery called to remove a bad gallbladder?
Cholecystectomy.
Okay. And Dr. Ginsburg, have you ever performed a cholecystectomy?
I have, around 2,500.
And what are the clinical symptoms for cholecystitis?
There's usually pain in the upper right quadrant, some nausea, possibly vomiting. It could be a combination of any of those symptoms or none of those symptoms.
So the symptoms can vary from patient to patient?
Yes, that is correct.
And would relief of chest pain since a patient's been in the hospital rule out cholecystitis?
No, because the pain is more episodic. It comes and goes.
And Doctor, moving on, what is the best test to show cholecystitis?
The gold standard would be the ultrasound report.
And are there alternative tests?
Yeah, there's a HIDA scan that can be done. There's also a CAT scan, an abdominal x-rays, but most physicians go off of the gold standard ultrasound report.
And in your opinion, did Dr. Sotomayor fall below the standard of care but by not ordering these alternative tests?
No.
And so far as tests go, did Dr. Sotomayor correctly rely on the ultrasound in proceeding with her treatment of Evelyn Roosevelt?
That is correct.
And when you're doing the physical exam of a patient, what is the typical scar you look for with a previous cholecystectomy?
Well, first I think it's very important that everyone understands that not everyone heals the exact same way. So there's a lot of variables that come into play with the variations of a scar. Skin texture, skin color,
they can have an influence on how the person will scar. The typical scar is located right around the umbilicus, and but there's also times where the scar can be invisible.
And have you ever personally had a situation where you missed a patient's scar?
Actually, I have.
And can you tell us more about that?
Yes, I had a patient who had symptoms that were similar to cholecystitis, and when I was about to have her be ordered to go do an ultrasound report, the patient informed me that she had her gallbladder already removed.
So the patient remedied the situation?
Yes, because I couldn't decipher. I didn't see the scars. It was all the patient.
And can a scar also differ depending on what doctor performs the surgery?
Yes, some doctors do 2 marks. I specifically do 2 marks. Some do 3. It just depends. It also depends on the procedure as well. There's a newer procedure where you can go straight through the belly button and no scarring would be present.
And in your opinion, is there a typical scar for a cholecystectomy?
I would say there's no such thing as a typical scar.
And going back to treatment, did Dr. Sotomayor justifiably rely on the ultrasound history and physical assessment in recommending Ms. Roosevelt for a cholecystectomy?
Yes, the compilation of both of those.
Okay. And doctor, you testified that you have performed numerous cholecystectomies. Are you familiar with the standard procedure for getting a patient's consent?
Yes, I am.
And what is the primary concern of a physician when they're getting a patient's consent?
You just want to make sure your patient understands, that they're alert, that they're cognizant of the procedure that you're about to have them go through.
And does the location where the consent occurs matter?
No, that's silly. That's a question of geography.
And in your practice, in the majority of cases in which a patient has signed a consent form, have there been any pre-operative medications given to these patients?
Yes, that is likely. Some patients come in with pain. We'll give them a pain shot before their surgery. It has minimum effect. It's like having a glass of wine or 2. Your job is just to make sure that the patient is still cognizant and understanding.
Have you performed any surgeries on patients on pre-operative medications?
Yes, I have.
And moving forward in the course of treatment, did the panel make any specific findings about, other specific findings about Sotomayor's treatment of Ms. Roosevelt?
Yes, we thought that the decision to proceed with surgery at the time, while the patient was on her meds, was acceptable because of that patient's cardiac history.
And can you tell me about the panel's reasoning behind this finding?
Well, as far as acceptable risk, the patient was on heart medication. She was elderly. She had an infection. They had to carry on with it. She was on 2 forms of medication, and those risks had to be calculated.
So you would classify the surgery as urgent?
Yes, it was urgent in a sense because she's an elderly woman who is in pain with an infection.
And was it within the standard of care to go forward with the surgery while Ms. Roosevelt was on these medications?
Yes, that is correct.
And doctor, are you familiar with the medication Plavix?
Yes, I am.
And tell me about your familiarity with this drug.
Plavix is a medication that is used to decrease the formation of blood clotting. It's usually given to patients that have blood vessel conditions or heart conditions.
And at the time this surgery was given to Ms. Roosevelt in 2001, how was Plavix viewed?
It was just becoming popular. Doctors were prescribing it for patients quite frequently. As far as how it was viewed in the surgeon field, I would say that it had minimum effect. There was, an increase of bleeding discussed with it, but nothing major to cause any alert to the field.
And doctor, as a surgeon, did you personally perform any surgeries on Plavix?
Yes, I have.
And tell me about that.
Well, I've actually done vascular surgery on patients who were on Plavix, and you would think that you wouldn't want to perform that type of surgery, but I've done it and I've had no problems.
And moving on to the other medication, Lovenox, are you familiar with that drug?
Yes, I am.
And can you tell me about your familiarity with it?
Again, it helps decrease the formation of blood clotting. It's prescribed more so for people who are about to have surgery.
And how was Lovenox viewed in 2001?
It was just becoming popular as well, and it also had a risk of increased bleeding, but nothing that was alerting to us in 2000s.
And have you ever operated on any patients on Lovenox?
Yes, I have. Actually, in St. Jefferson, we actually mandate that any patient that comes in that is going to undergo surgery is placed on Lovenox.
And would you perform a surgery on a patient on both of these medications, so Plavix and Lovenox, in 2001?
In 2001, I wouldn't have thought twice about it.
Okay. And what would be the risk of taking a patient with a cardiac history off their medications prior to surgery?
Well, there's a risk of that patient having some kind of heart condition or possibly a heart attack.
And based on your opinion, would you have to weigh this risk, the risk of the heart attack, compared to the increased risk of bleeding and surgery?
Yes, that is the calculation that the surgeon would have to make.
And whose decision is it to stop the medication prior to surgery?
It can be placed, the sole discretion can be placed on the surgeon.
And doctor, in your opinion, did Dr. Sotomayor fall below the standard of care in failing to stop these medications prior to surgery?
No, not in 2001.
And moving forward, in Dr. Sotomayor's treatment of the patient, subsequent to surgery, whose care is a patient in?
Subsequent, it's a team. It's a shared responsibility between the team.
Okay. And is the practice for monitoring the patient post-operatively the same in every hospital?
No, some hospitals have a team of medicines of 4 doctors that are looking after that patient. Some hospitals have it where there's just one doctor that looks after that patient.
So in your opinion, the standard of care for post-operative care of a patient could differ based on the hospital?
Yes, it does vary.
And what is your opinion, doctor, of the steps that Dr. Sotomayor took in her treatment of Evelyn Roosevelt?
I think it was I thought all her steps were acceptable. She had the clinical impression based upon the history and physical of the patient. That was then supported by the ultrasound report that indicated that there was a bad gallbladder with possible stones. She went based off of her impression and off of the ultrasound report and went ahead and performed the surgery.
Dr. Ginsburg, based on these steps, did Dr. Sotomayor ever follow the standard of care in her treatment of Evelyn Roosevelt?
No, she did not.
Thank you, Your Honor.
All right, Ms. Bell, thank you very much. Cross? All right, you may.
Your Honor?
Yes.
If it pleases the court, I'm going to be the scribe for our cross.
Okay, that's fine. And I should have my seating chart straight. That's Miss. You're going to conduct the cross-examination, Miss. Is that Miss Hurt? Miss Hurt?
Carrick.
Sorry, that's a certain.
I'm gonna get it straight. My seating chart's all off. Yeah, it's all off. But go right ahead, Miss Carrick.
Good morning, doctor. Good to see you again.
Good morning.
Hi. Do you remember me taking your deposition?
Yes.
Okay. And did you have a chance to review that deposition before today?
Yes.
Okay. Did you have a chance to review the ultrasound report in Evelyn's medical record?
I'm aware of it. Yeah.
Okay. Well, we're going to talk about that ultrasound report just a little bit. You've already stated on a number of occasions in your direct testimony that it's the gold standard for determining whether a gallbladder is present in a patient. Correct?
Yes, that is correct.
Okay. So, since the ultrasound report is the gold standard, would you give that just a quick glance, or would you read the whole thing?
Well, it depends on what I actually came up with my clinical diagnosis. If it matched when I read it the first time with the diagnosis that I came up with, a quick read would have been fine.
Okay, so you would give a quick read to an ultrasound report that you say is the gold standard.
Yeah, the ultrasound report said bad gallbladder. I had the hypothesis that it was a bad gallbladder. I would think that that's what it was.
Okay, so when you're giving this just a quick read, which part of the ultrasound report are you quickly reading?
The abnormal gallbladder, the possible shadowy stones.
Okay, so which part would you read then? What part of the ultrasound report would tell you that?
The description part.
The impression?
Yeah.
Okay, so we can agree then that since you've reviewed Evelyn's ultrasound report, that the very first 3 words of the impression says abnormal gallbladder region, right?
Yeah.
Okay, so if something is abnormal, wouldn't you then want to read the rest of the report? It's just 3 inches above that.
No, abnormal to me means it could be bad, it could be something wrong with it, and if I touched the patient, she was tender in that area, that goes with my hypothesis.
Okay, but on Evelyn's report, if you would have just looked up and read the whole report, wouldn't you, hypothetically, if you were reading this report as the general surgeon, would you not have read the words, assuming the gallbladder is still present?
Objection, Your Honor. Hypothetically speaking, is this a hypothetical situation? This is speculative.
All right, what's your response?
Your Honor, we're asking this.
She
We're asking this
should-
witness based on her experience and expertise, whether or not, if she was in Dr. Sotomayor's same or similar circumstance, if she would have read the whole report.
All right, calls for speculation sustained.
If I was in Dr. Sotomayor's...
The objection is sustained.
Oh, okay.
So
I didn't hear
the
you.
next question should be posed.
Okay, Your Honor, I'm marking this piece of evidence as plaintiff's exhibit 3.
Okay.
This is the ultrasound report. You have a copy of this?
Yeah, we have copies.
Yeah, Coach.
You may. Is that your copy?
It's the copy I'm going to show
All
her.
right, very good.
Okay.
Go right ahead.
Yeah, Coach.
You may.
What is this?
This is the ultrasound report.
Okay, and can you read the highlighted portions for me, please?
Yes, impression, abnormal gallbladder region.
Okay, and if you would have received this report, would you then not read the entire report?
And you're asking me my opinion, and my opinion is if I had the clinical impression before I looked at the ultrasound report that there was possibly a bad gallbladder, looking at those first 3 words is enough for me to say, sounds like I'm right.
Okay, so you're basing your clinical diagnosis on what?
The actual physical and the actual physical examination of the patient.
Okay, so doctor, when you're doing a physical examination on a patient that you might be doing a gallbladder surgery on, are you going to examine their abdomen?
Yes.
Okay, and when you do a gallbladder surgery, are you not going in around the belly button in the abdomen of the patient?
That's true.
Okay, so if there's a scar around that area in which you're going to be going into to perform this surgery, don't you think you should notice that scar?
Well, as I've said earlier, when I was being directed, that I had an incident where I didn't see a scar before. So, I mean, I'm not going to say that Dr. Sotomayor saw the scar.
Okay, I didn't ask you to say whether he saw the scar. I'm asking if you're going to go in that specific area, don't you think that you would see a scar around that same specific area?
Again, that's possible.
It's possible, but yet here the gastroenterologist did see her scar.
He saw it, Dr. Sotomayor didn't.
Right, Dr. Sotomayor did not see the same scar that a previous physician had seen and noted in the medical record.
That's true, and that's possible.
It is possible because it did happen.
Yes.
Actually. So you testified in your deposition that if Dr. Sotomayor or a doctor, general surgeon doctor, would have seen that scar, it would have been the standard of care then to ask, what was that surgery?
Yes, if Dr. Sotomayor saw the scar, that would have to been done.
Okay, so he didn't ask because he didn't see it.
That's true.
And so therefore there was a violation of the standard of care?
No, he did not see it, so he did not ask. There is no violation of standard of care there.
Okay, so don't you think that he should have seen that scar?
I'm not going to answer to what he should have, should not seen.
Okay, there's been an objection, and what is the response?
I haven't asked her that specific question.
The objection is repetitive?
Yes.
Overruled.
Okay, doctor. Let's move away from the scar then. You've already testified that hospital patient care is a collaborative effort. That's a team effort.
Yeah.
Okay. So, as a general surgeon, if you're calling in for a consult, you and I can agree that the patient's probably already seen 1 or 2 physicians.
That's very true.
Okay. So, since you're not caring for the patient 100% of the time, how is it that you find out what's going on with your patient in your absence?
You stay in contact with the doctors, as Dr. Sotomayor did with Dr. Thomas and Dr. Oscar Meyer.
Okay, so what if the doctors are unavailable? I'm sure you aren't on the clock 24/7. There are other times when you're not available. So what happens when you can't speak to the doctor?
Objection, compound question.
Overruled. Overruled. If you would like to rephrase, you may.
Actually, I would like for you to repeat the question.
Okay, so if you are unable to reach another doctor, because you said you could just speak with the other doctors, if you can't reach the other doctors, then what do you do?
And when it comes to my patient, I'm going to make sure I reach the doctor.
Okay, so since you can't always reach the doctor, what happens when you can't do that?
I'm going to make sure that I reach the doctor.
Doctor, you're not answering my question because just because you might make sure
Objection, badgering the witness.
Overruled.
Doctor, if you cannot reach another physician that has treated your patient, as I know that this has happened before, how?
With who?
With myself, with our witness?
Well, I'm going to speak from my personal experience. I always make sure to stay in contact with my physicians that are working on my patients.
Okay. Why would you not consult the medical record?
You know, what do you mean? Elaborate.
Why would you not consult the medical record when you cannot reach another physician?
The medical
For
record.
objection,
What's the nature of the objection?
assuming facts not evidence, this is an inaccurate hypothetical.
Okay. What's the response?
It's not an accurate hypothetical.
It's a question as to whether or not, why she wouldn't review the record? That
Yes,
was the question?
why would she, I asked her why she wouldn't review the record if she hasn't been able to meet or reach other physicians.
All right, very good. It's overruled.
Doctor, would you and I be able to agree that if you could not reach the other physicians, that you would then consult the medical record?
Yes.
Okay, and here, if you would have consulted Evelyn's medical record, if you were the treating physician and you would have consulted her record, would you have seen the ER physician's entries?
If I would have read the complete record, yes, but she didn't need to.
Okay, so you're saying that when treating a patient, you don't need to consult every part of the
No, I'm
medical
not
record?
saying that. She was in
Objection.
contact with the other
What's the
physicians.
nature of the objection?
Speculative and battering the witness still.
Speculative and badgering the witness. Overruled and overruled.
Okay.
You may proceed.
Takes a lot to badger a witness.
Indeed, it does.
Doctor, if you were treating Evelyn Roosevelt and you had read the entire medical record, would you have seen the ER physician's notes?
Hypothetically, if I would have read the whole document, yes.
Okay, so since if you would not, I'm sorry. Are you telling us that the medical record is not important enough to read the whole thing?
No, I'm not saying that in essence. I'm saying she was in communication with the primary physician. She had her clinical impression. The ultrasound supported that clinical impression. She's a doctor. She has every right to make that cognizant, understanding decision on her own.
But as a doctor, she doesn't have the right to read the entire medical record when treating her patient?
No, she does have the right.
But she didn't do it here.
And I don't think that's an issue.
You don't think it's an issue that she didn't read the entire medical record when that record specifically stated that the surgery she was doing had already been done?
Again, my opinion is that she had the clinical impression diagnosis of cholecystitis. From there, it was supported by the ultrasound report. She could have continued with the surgery.
But in the event that she continued with the surgery that was unnecessary and it resulted in...
Objection. Assuming facts and evidence with the unnecessariness of the surgery.
All right, what's the response?
There is no response, Your Honor.
There is no response? I'm going to sustain on that basis.
Doctor, in your opinion, if the consulting surgeon here would have read the entire medical record, would he have seen that Miss Roosevelt's gallbladder had already been removed?
Yes, but I don't think it was necessary.
Right, you've stated that.
And you've asked me multiple times.
So isn't it true that Dr. Sotomayor has already admitted in his deposition that the complications that arose from this procedure started a cascade of events that resulted in her demise?
Just repeat that again, slower.
Objection. This witness has not read Dr. Sotomayor's deposition prior to coming to trial.
Well,
It's assumed that all the witnesses, in the rules of the stock, it's assumed that all the witnesses read all the depositions in the rules of the
okay.
ALJ
Well,
competition.
I tell you what, I'm going to overrule just because I didn't hear the question either. The witness didn't hear the question, so if you would please state the question once again. And if you wish to object at that point, object again.
Okay. Thank you, Your Honor.
Doctor, isn't it true that in Dr. Sotomayor's deposition, in his own deposition, that he stated that this procedure, this unnecessary procedure, was the start of
Again,
a
objection,
cascade?
unnecessary procedure. It was
Okay.
already sustained.
It's overruled just because I haven't heard the question.
Okay, Your Honor.
Okay. State, if you would, Ms. Garrick. Go right ahead.
Doctor, isn't it true that in Dr. Sotomayor's own deposition, he stated that this procedure started the cascade of events that resulted in Miss Roosevelt's demise?
I'm not sure what you're asking me.
I'm asking you to clarify and tell me if it is true that Dr. Sotomayor admitted in his own deposition that this procedure, that the gallbladder removal procedure, started the cascade of events which resulted in Miss Roosevelt's death.
I would say so.
Yes. So, since Dr. Sotomayor admits that those complications were the start of the cascade of events that resulted in her death, then you and I can agree that had this procedure not happened, Miss Roosevelt would be here today, or not have died in that hospital.
Objection and compound question.
The objection is a compound question. That's overruled, but it is sustained as to speculation.
No, sorry.
Doctor, can you just answer my final question for me?
It was sustained.
This is a separate question,
this is
and that's why I should answer one final question for me.
Go ahead.
Thank you, I'm aware. Thank you. Is death a known and accepted complication of a gallbladder removal surgery for a gallbladder that wasn't present in a patient?
I wouldn't say it's a known complication.
No, so it's not.
I wouldn't say it was a known complication.
Thank you.
You're
All
welcome.
right, thank you, Ms. Carrick. And Dr. Ginsburg, thank you very much. Do we have additional questions for Dr. Ginsburg?
Yes, Your Honor.
All right,
I'd like to
Dr. Ginsburg,
redirect.
if you would please remain, there are additional questions for you.
Thank you, Your Honor.
All right. Ms. Ball, right?
Yes.
Ms. Ball, go right ahead, Ms. Ball.
Dr. Ginsburg, I believe in your deposition, which my opposing counsel was so friendly to bring up, you classified some of the words used as ambiguities. But were these ambiguities enough that you would have not proceeded with the surgery relying on the ultrasound report?
The words possible, and are you referring to those words?
Yes, Your Honor. Yes.
It was very subtle.
Okay, so in your opinion, these were subtle classifiers?
Subtle classifiers that would not have drawn much attention.
Okay, and doctor, how many cholecystectomies have you performed in your career?
2,500.
Okay, thank you. And is there a typical scar for a gallbladder removal surgery?
Again, no.
And if Dr. Sotomayor would have seen the scar, would the surgery have happened?
No, she would have seen it and she wouldn't have proceeded.
In your opinion, did Dr. Sotomayor see the scar?
She did not see the scar.
And one last question. Dr. Ginsburg, in your opinion, did Dr. Sotomayor ever fall below the standard of care in treating Evelyn Roosevelt?
No, she did not.
Thank you.
All right, thank you very much. Now, Ms. Carrick, do you have additional questions? Ms. Carrick, do you have additional questions? All right, very good. Dr. Ginsburg, you may step down, assume your seat. Well, actually, you can go about the normal course of your business if you choose. You can. I mean, we like, in Division 6 of the Jefferson Circuit Court, we like a healthy amount of animosity between the parties. We think it's good. It fosters a good trial, because I tell them, don't get the lawyers know I love a jury trial. So the lawyers, they're apologizing normally because they tell the judge, well, we didn't settle, we got to go, I'm sorry, Judge. And here they come in and say, I'm sorry, Judge, we settled the case. We're not going to be able to try it because I like to, I talk about, I like to create, I like them to have just the slightest bit of animosity so that they will disagree enough to try their case. So when you said that, yeah, it's hard to get badgering the witness. Yeah, it's tough. I mean, you got to be tough in here as a witness. If I sustain that, it's going to probably involve some bloodshed. Who's the next witness on behalf of the defendants?
Dr. Sotomayor.
All right, Dr. Sotomayor, if you would please assume the witness stand.
Oh, and Your Honor, if we could move plaintiff's exhibit, I believe they're done with it.
Okay, that would be good. It's obscuring. You're gonna, yeah, if you would.
Very direct then, and you guys.
Well, that's fine. It's obscuring the view of the jury at this point anyway, so it needs to be moved. Dr. Sotomayor, if you would please raise your right hand. You swear a firm testimony you're about to give will be the truth, the whole truth, nothing but the truth, so help you God?
I do.
All right, please have a seat there. Please keep your voice up for the purpose of the record, for the hearing of the jury and the court. Ms. Shannon. Ms. Shannon, you may question.
Can you please state your name and business address for the record?
My name is Sydney Sotomayor, and my address is 120 Wall Street, State of Justice.
And can you tell us about your educational background?
I went to undergraduate at LSU, where I graduated in 1972. I proceeded to go to LSU's med school in New Orleans. I graduated from there in 1976.
And after graduating medical school, where did you complete your residency?
I completed my residency through the Department of Surgery through LSU. Mostly we were based out of the University Hospital. And at the time it was a 4-year program, but I have been informed that it's recently been changed to a 5-year.
And after your residency, did you sit for any boards?
Yes, I sat and passed my boards in 1983.
And what is your area of expertise?
General surgery.
What hospitals do you currently have privileges at?
I currently have admitting privileges at All Saints and University Hospital, and then I also have consulting privileges at Hood Hospital.
Have you ever testified before?
I have. I was a treating physician in a murder case.
Are there any texts or publications that you refer to in your practice?
As far as textbooks go, we prefer Sabiston's textbook of surgery, and then we also look to Schwartz. There are a lot of journals and magazines that come to the office. The three that we consult the most are the American Journal of Surgery, American Surgeons, and Archives of Surgery. We get some throwaway ones as well. For example, Contemporary Today comes to the office. We don't normally consult that.
And why is that?
I just don't personally find it to be as prestigious or informative as the others.
And doctor, I'm now going to shift your focus to November of 2001. Were you employed?
I was. I was self-employed in a partnership called Surgical Associates. At the time it was Dr. Lewis, Dr. Oscar Meyer, who I'll discuss a little bit later, he was involved in the case, and myself.
And is Surgical Associates currently in good standing?
Yes, it is.
And doctor, have you ever treated Evelyn Roosevelt?
I have.
And what was the date that you began your treatment?
The first time I actually saw Miss Roosevelt was November 8th, 2001, around 9 or 10 in the morning. She was in the endoscopy holding area. I had gone to the room where I believed her to be waiting, but I was informed she'd been moved down to the holding area, which is why I went down there to see her.
And how exactly did you come about to being treating Evelyn Roosevelt?
Well, on November 6th, Dr. Thomas, her family care physician, had called me. He had told me that she had gone to the hospital with chest pain, and there was a concern that with the workup there was evidence of gallbladder disease. So he asked me to go see the patient to give my general surgery opinion and consultation.
So you said you met Evelyn Roosevelt in the endoscopy area.
I did.
When you were in the endoscopy area with Evelyn, what exactly did you do?
Well, first, standing with every patient, I kind of go in, introduce myself, try to make the patient as comfortable as possible. I told her I was there. I told her that Dr. Thomas, her family care doctor with whom she was familiar, had specifically asked me to come talk to her. And I just started to kind of do my normal routine with patients. I always look at, if available, the family care physician's history and physical, and then I do a history and physical of my own.
And you said Dr. Thomas consulted you. What was the nature of that conversation you had with him?
He just asked for my general surgical opinion.
And you say that you did a standard consultation with Ms. Roosevelt. Can you elaborate on that, what that is comprised of?
Again, if available, I look at the family care physician, especially in this case since he had been the one to call me directly. I look at his history and physical, and then I always make sure to do my own history and physical with the patient as well. In this case also, I had consulted the ultrasound report that we've mentioned from Dr. Roberts, and I was additionally interested in her cardiac situation. Dr. Gramillion had done a cardiac evaluation, so I looked at those records as well.
So you looked at records from Dr. Gramillion. Were there any other doctor's records that you looked at?
Nope, just the ones I just mentioned.
And you said that you did look at some records by Dr. Roberts. Did you discuss any findings with him?
I did. He was available in the area, so after I assessed the situation and found there to be cholecystitis, I discussed with Dr. Roberts and Dr. Thomas my findings.
Okay. And going back to the physical assessment you did of Evelyn Roosevelt, where did this take place geographically in the hospital?
It was in the endoscopy holding area since the patient had been there when I arrived to see her.
And was anyone else present during this physical exam?
One of her daughters, but she had a lot of kids at the hospital, so I can't recall the name of that daughter.
Okay. And for the physical exam, can you detail exactly what you do?
Okay, so I start with examining the eyes. Then I do all of the head and neck. I proceed downwards from there. So I do listen to her lungs, I listen to her heart, I do a breast exam, a chest exam, I do the axilla. In this particular case, I made sure to do both a manual and a physical examination of the abdomen. So the manual also includes palpations of the abdomen as well as taking my stethoscope and doing an oscillation, listening to what's going on down there. I also do a rectal exam and all of the lower extremities and feet.
Okay. And did you discuss your findings? What were your findings of the physical exam?
I found there to be chronic cholecystitis with cholelithiasis and recent biliary colic.
And you said in addition to the physical exam, you also took her medical history.
I did.
Did you discuss any past surgical history with Ms. Roosevelt?
I did. She mentioned that she had had a kidney stone removal and also that she'd had left shoulder surgery.
And did you ask her specifically about any gallbladder issues?
I did. When I did the palpations of her abdomen, there was a reaction in the upper right quadrant, so I inquired into whether she'd had any gallbladder problems before, which she answered no. And her daughter was also in the room at this time.
Okay. And how did you put together your findings?
It was a combination of things. With the history and the physical exam, she had a history of heartburn and indigestion, which can be indicative of some gallbladder issues. Also, you know, she was tender to the touch when I palpated the area where the gallbladder exists in the upper right quadrant. Also, I looked at that ultrasound report that has been discussed today, and that confirmed my suspicion that there was some gallbladder inflammation potentially. And then also when I looked at her labs, the bilirubin level was elevated to 1.2. It was the upper level of normal at the time in 2001, and that caused a little more affirmation in my mind of a gallbladder issue.
Do you record or chart these findings anywhere?
I do. I always write a dictated consultation.
Okay. Your Honor, I'd like to mark Defense Exhibit Number 2.
All right.
It's the directed consultation. Your Honor, may I approach?
You may.
This is the directed consultation that Dr. Sotomayor is currently referring to. May I approach the witness?
You may.
Dr. Sotomayor, can you tell us what this is?
That's my dictated consultation to which I just referred.
Okay, and what's the date on that?
It is November 8th, 2001.
Your Honor, I'd like to enter this into evidence as Defense Exhibit Number 2.
All right. Is there any objection to the admission of Defense Exhibit 2?
Just that it hasn't been properly identified and authenticated yet.
Okay.
I think under the rules, we presume that all the documents are authentic.
That's right.
Oh, I'm sorry.
Well, I've overruled anyway. It's admitted.
Now we both forgot.
It's admitted as Defense 2. Yeah.
And, Your Honor, excuse me, Dr. Sotomayor, in your dictated consultation, what were the previous surgeries that you were told by Ms. Roosevelt?
Both by Ms. Roosevelt and her H&P, and then in the H&P that I looked at from her family care physician, Dr. Thomas, it only listed a kidney stone removal and a left shoulder surgery.
And how did you obtain this information?
Both from asking the patient in my H&P, and then I also, again, consulted Dr. Thomas's records.
And based on your physical exam and the past medical history, what was your impression?
My impression was that she had cholecystitis.
And this was based on what?
Again, you know, combination of the history and physical, the chest pain, the tenderness in the upper right quadrant, that bilirubin level that I mentioned, and you know, it was validated when I looked at the ultrasound report. So I deduced that there was a gallbladder issue.
Can you kind of break down these medical terms? What exactly is the significance of the bilirubin being in the upper limits of normal?
Well, and again, this was in 2001, so it has changed since then, but at that time, the bilirubin level was at the upper level normal. That can mean a few things depending on the scenario, but when there's a potential gallbladder issue, that can indicate inflammation or lack thereof in the gallbladder or the liver.
And you also mentioned tenderness in the upper right quadrant. What is that significant?
Well, not only does that signify, you know, that again, that's where the gallbladder is located. So not only does that signify that there's a potential gallbladder issue, but because of the pain she was experiencing, that indicated to me that it was urgent, and I wanted to proceed with surgery as quickly as possible to alleviate my patient's pain.
Doctor, previously you stated that during the physical exam there was a daughter that you cannot remember. Did you have any discussions with that daughter that was present in the exam room?
Yes, everything that I discussed with the patient, I also discussed simultaneously with the daughter. So that included my findings and how I wanted to proceed with surgery. I wanted to do it urgently as to alleviate her pain.
So after cultivating your findings and discussing things, what was your recommendation?
I recommended that we proceed with the laparoscopic cholecystitis, the removal of the gallbladder.
And for the removal...
Cholecystectomy, excuse me.
And for the removal of the gallbladder, what is the standard and most proficient test?
The ultrasound. It's the gold standard.
And for this test, what did you come away with that test from?
Well, since I'd already looked at Dr. Thomas's records and I'd done my own H&P, it was essentially just bolstering my medical conclusion that she had a gallbladder issue and I needed to proceed with surgery.
So after this conclusion, did you discuss this recommendation with the patient?
Yes, I did. I discussed it with the patient immediately after.
Did you discuss your recommendation with anyone else?
I did. I actually called Dr. Thomas on the phone and discussed my findings with him. And then Dr. Roberts, who had performed the ultrasound, was still in the area, so I also discussed my findings and conclusions with him.
After discussing your findings and conclusions with those two doctors, what happened next?
We scheduled surgery for later that day.
Is there a reason why surgery was scheduled for later that day?
Again, to me, we have 3 levels of surgery. You've got your elective, you've got your urgent, you've got your emergent. Emergent is something you have to do immediately in the moment. Urgent, for me, is something that you maybe don't have to do immediately, but you don't want to prolong it longer than you have to because typically the patient is in a significant amount of pain, and I feel it's my duty as a surgeon to alleviate that pain as soon as possible.
And after this recommendation, was there any consent form filled out?
There was.
And were there any further tests or studies done before surgery?
There were not. And as far as the consent form goes, I always go over consent with the patients, but it's my policy to actually have the signing of the consent done with a nurse who, again, goes through that form with them and obtains consent.
Great, thank you. Going back to kind of the tests that were done, were there any abdominal x-rays available to you at this time?
There were not.
And did Evelyn Roosevelt have surgery to remove her gallbladder?
She did.
And what is the surgery called?
It's a laparoscopic cholecystectomy.
And at this time, do you recall being told by anyone in the Roosevelt family that she had previous gallbladder surgery?
I do not.
And after you performed the surgery, did you discuss your findings with the family?
I did.
And what did you tell them?
I told them that once I went in there, it was obvious that there had been a gallbladder surgery done previously. This information was revealed to me through the cholecystectomy. I also felt like what might have been a remnant of the gallbladder that had been left behind, which could have been what was indicating and contributing to these symptoms. So at that point, I recommended ERCP to explore a little further exactly what was going on in that abdomen.
Can you explain to us what an ERCP is? So
it's a complicated procedure. It's done by a gastroenterologist, which is not my specialty. But basically, you're taking a little camera lighted tube. You put it down the esophagus, through the stomach, and into the small intestine. At that point, you inject a little catheter that's going to inject some dye into the common bile duct as well as the pancreatic duct, and that allows you to kind of visualize what's going on in the abdomen, what might be causing some of these symptoms.
Did you discuss your recommendation for the ERCP with anyone?
I did. I discussed it with Dr. Thomas. Again, I had called him immediately after surgery, and then I also discussed it with the patient.
When you called Dr. Thomas, what exactly did you tell him?
I told him, similar to what I had told the patient, that it was obvious from the cholecystectomy that there had been a prior gallbladder surgery, that I felt there might be a piece of the gallbladder left behind, a remnant as we call it, and that might be contributing to the symptoms. So I felt an ERCP was necessary so that I could have all the information before I went further.
And after the surgery, did you follow up with Ms. Roosevelt?
I did.
And how exactly did you follow up?
I would do what we call post-operative rounds.
And can you explain what those rounds are?
It's basically after you do surgery, you're working with so in this case, I was working on a team with Dr. Thomas, who's the family care doctor, and then my practice, and you go and check in on the patient after the surgery's occurred, just to make sure the vitals are stable, see if any complications have occurred. In this specific time, because I was in an association with 2 other doctors. Sometimes it depends who is on call, who goes and visits the patient. But I was a little concerned with Miss Roosevelt's results, so even though my partner, Dr. Oscar Meyer, was on call at that time, I called him, I told him what was going on, and I made sure to go by myself and check in on the patient additionally.
And from these follow-up visits, do you record your findings?
I do. I write what's called a post-operative note, or a progress note.
And for these post-operative rounds, who would actually be doing these rounds besides you?
Again, Dr. Thomas has a role in checking in on his patient. He's been seeing the patient for years. And again, I said, it depends on who's on call. So Dr. Oscar Meyer happened to be on call at this time, so he, in addition to myself, was going in and checking on the patient and keeping me informed on her status.
And from your findings, what exactly would you have noted after this?
Can you
during your follow-ups, what was something that you would have noted? Were there any findings or?
We were a little concerned because of her white blood cell count, and then also the hematocrit was at level 27. These can be things that occur after surgery, but the levels on the labs were slightly abnormal. So that's something about which I notified Dr. Oscar Meyer to kind of keep an extra eye on her in case they dropped further.
So is there anything in general that you monitor during this time?
Just kind of her condition.
Okay. So generally speaking, the things like the white blood cells and the hematocrit, what would you describe that as? What?
The H&H.
Okay.
We also make sure to check on the vitals of the patient, but that's something that's actually taken by the nurse. So they create what's called a graphic sheet. So they take her pulse, her respiration, the I-40s. They check her blood pressure, and that's included in their graphic sheet. So that's something, in addition to viewing all the labs, we kind of always try to keep on top of the vitals.
So these graphic sheets, is it standard practice to rely on those?
Yes.
And what exactly is included in these graphic sheets?
Again, it's just heart rate, blood pressure, respiration, I-40s, and that's, again, something that the nurses do, but they write it on the graphic sheet, and it's up to us to look at them whenever we come in on rounds.
So you mentioned that also during this time, another doctor, Dr. Oscar Meyer, would be seeing her. When would Dr. Oscar Meyer be seeing Ms. Roosevelt?
If I remember correctly, he was seeing her on the 10th of November. But again, on that morning, I had called him and kind of let him know about this white blood cell count and the hematocrit level that was concerning to me. Just told him overall what was going on, and had frequent communication with him throughout the time to make sure that I wasn't missing anything that he observed, staying on top of patient care as much as possible.
And did he relay any of his observations to you?
Yes. Unfortunately, at one point, she did go into cardiac arrest, and she was successfully resuscitated, but then there was also some renal failure, so they'd had to put her on dialysis.
So during this time, how would you describe her condition?
Fortunately, it was starting to decline at that point.
And at that point in time, what was the recommendation?
At that point, I felt that we should do laparoscopy in order to kind of figure out, again, more succinctly what was going on in her abdomen that was causing these levels to drop so dramatically.
And when was the next time that you saw the patient?
I saw her on November 11th around 3 in the afternoon, I believe.
Okay. And for that laparoscopy that you recommended, did that procedure actually take place?
Yes, it did.
And did you discuss the surgery with anyone?
I did. I discussed it with her family members at this point. They were who I was in communication with. She was not really able to discuss the procedure with me, so I discussed it with, she had, again, a lot of family members present, so I made sure to talk with family, and then also I was discussing them with Dr. Thomas.
And you said she wasn't able to discuss this with you. Who are you referring to when you say she wasn't
I'm
able to
sorry,
discuss it?
the patient, Ms. Roosevelt.
Okay. And who exactly did you talk to from the family?
You know, there was a lot of family present. I couldn't name names. I'm sure I'd be able to recognize some faces if I saw them, but There's a lot of people. It was a hectic situation.
And was consent given for this surgery?
It was.
And who gave that consent?
It was given by a family member. It wasn't given by the patient herself. She was unable to do so.
And did you perform that surgery?
I did.
And what did you find during that surgery?
We found blood in the abdomen. There was not an active source of bleeding. There was no active bleeding going on. And, you know, we tried to locate the source. We were unable to find it. So at that point, we decided to administer fresh frozen plasma.
And what did you do after that procedure?
Just administering the plasma to try and prevent against the bleed.
And did you discuss that course of action with the family?
I did.
And did you tell the family what that surgery revealed?
I did. You know, laparoscopy, you're going in essentially, you're making a small incision and putting a camera a small camera into the abdomen to kind of, again, see what's going on, just get a good assessment. And so I told them what we were going to do, and then indicated to them that we had found bleeding, that we unfortunately weren't sure of the source, but the fact that there was no active bleeding at that time.
And doctor, I'm going to ask you a few questions just about your professional ethics and malpractice generally.
Sure.
Could you remind us again, how many years have you been practicing?
I passed my boards in 1983, and I've been practicing ever since.
Have you ever had any action taken against your medical license?
I have not.
Have you ever had your privileges suspended or denied by any institution?
I have not.
Do you belong to any professional organizations?
I do. I'm a fellow with the American College of Surgeons. I'm also a member of the Surgical Association of Justice and then the Southwest Surgical Congress.
Have you ever served on a medical review panel?
I have.
And has a medical review panel ever taken action against you?
Yes.
And what happened there?
There were two different instances where a medical panel reviewed something that I have done. The first, there was a patient who had a colon disorder that unfortunately caused a lot of bleeding. We went in to try and figure out what was going on, why there's bleeding, try to remedy the bleeding. Unfortunately, this patient had also had, because of her colon condition, a lot of prior surgeries, so there was a lot of adhesions, a lot of scar tissue, and that, when we went in to do surgery, unfortunately, because of those things, we were not able to stop the bleed. There were then some postoperative complications, including anastomatic leakage. We did the best we could, and when the medical review panel looked at the case, they found unanimously in my favor. Then the other procedure, I had a patient who'd had an inguinal hernia repair, and he had some postoperative pain, and in this situation, again, the medical review panel found unanimously in my favor.
Have you ever had a medical malpractice suit filed against you?
I've not.
So in 30 years, you've only had 2 actions that were unanimously dismissed?
Yes.
Doctor, do you believe that, based on your education, your training, and all of your experience, that your treatment of Miss Roosevelt fell below the standard of care?
I do not.
All right, thank you, Ms. Shannon. Is there cross-examination? All right. Who's going to conduct that? Is that Ms. Bush?
Can you put that over here?
Here, let me do it.
Yeah. Oh, yeah, Sheriff will take care of that. He's an expert. Let's see.
The defendant. Oh, okay. And the jury, of course.
Yeah.
Your Honor, may I ask the jury to take a seat?
Excellent, Ms. Bush. Excellent.
We've learned.
Can you see that, ladies and gentlemen of the jury?
Kind
All right. That's excellent. That's excellent. That's good stuff. That's good stuff.
I'm sorry.
No. Sometimes you got to set the example, Mr. O'Brien. You know, you got to set the example sometimes. Go right ahead, Ms. Bush. You may question.
Dr. Sotomayor, is death a known and accepted consequence for the removal of a gallbladder?
Death can happen with any surgical procedure.
I didn't ask you death was a risk. I asked you, is death a known and acceptable complication?
I don't think you're ever going to get a doctor to say that death is acceptable.
Your Honor, I have what I'm going to mark Plaintiff's Exhibit number 4
All
for
right.
identification. May I please approach?
You may.
The consent form for the first surgery.
Okay, thank you.
Your Honor, this is the consent form for the first surgery.
All right, very good.
Here you are, Dr. Sotomayor.
Thank you.
What is that document?
This is the consent form from November 8th, 2001.
Doctor, how do you recognize this document?
What do you mean, how do I recognize it?
Does it have your signature on the 3rd page, 4th page?
Yes, it does.
Doctor, on the first page of that document, there's a list of 5 risks associated with a talk to me. Can you please read them?
Pancreatitis, which is inflammation of the gland that produces insulin. Injury to the tube, the common bile duct between the liver and the bowel. Retained stones in the tube, the common bile duct between the liver and the bowel. Narrowing or obstruction of the tube, common bile duct between the liver and the bowel. And injury to the bowel and or intestinal obstruction.
Now, doctor, death was not on that list, correct?
No, but you're never going to write death on a consent form.
There's an other, right? There's a blank on that short form that has other, correct?
Yes.
Or other risks?
Yes.
Nothing is written there, correct?
No.
Okay. Now, that is the form on which Ms. Roosevelt acknowledged the risks of the surgery that she
Your
was
Honor, objection. Narrative.
All right. Narrative? What's the response? What do you mean narrative? What do you mean narrative?
There's a question in there.
Well, what does narrative mean?
She was just expressing her opinions based on the response. There was no question.
This is when the judge, if the judge doesn't understand the objection, I just overrule it. I'm telling on myself, it's overruled. You may proceed.
Now, doctor, that's a consent form on which Ms. Roosevelt acknowledged the risk of her cholecystectomy, correct?
Yes.
Doctor, can you please read the top right-hand portion of that consent form next to where it says 110801?
Gastroscopy?
And that is the exact procedure that Ms. Roosevelt was being prepped for when you approached her in the holding area, correct?
Yes.
Okay. Now, can you please turn to page 3 of that document? The top right-hand corner of that document looks a little different, doesn't it?
Yes.
Okay. Can you tell me what is different about the top right-hand corner of that document as compared to page 1?
It seems that gastroscopy was scratched out for lap cholecystectomy, which is laparoscopic cholecystectomy, removal of the gallbladder.
Okay. Now, is a hospital procedure when you cross something out on a form to sign or initial the change?
You know, I can't speak for every hospital's rules, procedures, especially in a situation in which a doctor feels it's emergent.
Did you feel that this was emergent?
Or urgent, excuse me. I used the wrong word.
Just wanted to clarify. So there's no date, no initial next to that, correct?
Correct.
Okay. Can you please turn to page 4 of that document?
Sure.
Can you please read what it says in the top right-hand corner of page 4 of that document?
110801 gastroscopy.
Is gastroscopy crossed out on that page?
It's not.
Okay. Can you please turn to page 5? Can you please read the top right-hand corner of page 5?
110801 gastroscopy.
Is that crossed out?
It's not.
Do the words laparoscopic cholecystectomy or gallbladder removal appear anywhere on page 5?
Not that I can see.
No, they don't. So page 5 is in fact Evelyn Roosevelt signed page 5, correct?
It appears so.
Doctor, I don't know about you, but it seems a little confusing to me that this page that Ms. Roosevelt signed doesn't have anything with the word gallbladder remover or laparoscopic cholecystectomy.
You know, I agree with you, and I think, unfortunately, when these consent forms and things were done in paper form, it was a lot harder to make changes. Now that they've changed everything over to EMR, it's a lot easier for us to keep our files in order to keep them properly named, tagged, etc.
But one of the pages was changed, correct? You mentioned
Yes.
page 3
Yes.
had been changed, but the other of the 5 pages, only one of them had been changed, correct?
Yes, but again, when I had gone over consent with the patient, she was well aware of the surgery we were doing, as was her family.
Okay. Now, doctor, there's another consent form on the record, correct?
Yes.
Your Honor, I move to admit plaintiff's exhibit number 5 for identification.
Oh, okay. So you're marketing for identification?
Yep.
All right. 5, you may approach.
The second, from the first surgery? The consent forms with the date discrepancy.
Okay.
Your Honor, this is the consent forms for a separate procedure,
Okay,
allegedly.
you can present that to the witness.
You're our witness.
Thank you.
At this time, can I move to admit exhibit 4, plaintiff's exhibit 4 into evidence?
I think that's exhibit 5, actually.
That's 5, you said,
No,
right?
she's got 4 in her hand.
Oh, you're going to
switch
move the previous 4?
Yeah, okay, cool.
Is there any objection to 4? The admission of 4?
No.
Ms. Ball, right?
No, Your Honor.
Oh, objection. Okay, very good. And now so 4 is admitted, and 5 you're going to question about, right?
Doctor, the consent form I just handed you, that's not signed by Evelyn Roosevelt, correct?
Can you give me a minute to look through it?
Yeah.
Okay. No, it appears this is the one that, I guess it was Jessie Roosevelt, that had been signed by the family member when the patient was unable to sign for herself.
What is the initial surgery date in the top right-hand corner of that consent form?
November 8th, 2001.
Okay, so the same date of the first surgery, correct?
Yes.
Now, can you please read on page 1, next to where it says procedure, I believe it's B, purpose? Will you please read the purpose of what the second surgery was?
To remove the gallbladder.
Okay, the gallbladder that we knew wasn't there after the first procedure, correct?
Yes.
Okay. Can you please turn to the last page, the second, because Ms. Roosevelt's daughter signed that document twice, correct?
It appears so.
First and the last page.
Yes.
Do the dates on the first and the last page of Mrs. Roosevelt's daughter's signature match?
Well, they match on the top of the form, but the date is different where she's signed, so I'm not sure what you mean, do they match?
Her signature. Does her signature date on the first page match her signature date on the last page?
There's no signature date on the first page.
Okay, the last page.
Okay.
What is her signature date on the last page?
It's November 10th, 2001.
Okay. Doctor, you signed this document as well.
Yes. Looks like I signed on page 2 of the document.
Okay. So, the daughter signed on the 10th. What day did you sign?
I signed page 2 on the 8th.
Okay. Is it standard practice for a doctor to sign a document 2 pages before the patient?
But, again, we've changed the way that we do consent, so that's a very complicated question.
Is it procedure for a doctor to sign a consent form saying that he informs the patient of the procedure 2 days before the patient signs affirming the same thing?
It would depend on the case scenario. I can't answer for every single situation that would arise.
The date on the informed consent form was also the 10th. The procedure on that consent form says it was performed on the 8th. Is it standard practice to have the patient sign an informed consent form 2 days after the procedure?
Well, no, but it seems that some things have gotten mixed up in terms of time. And again, that's why we now require things to be done via EMR to eliminate these sorts of problems.
Are you saying that there are clerical errors on the consent forms?
It appears so.
Okay. So the consent forms that you're relying on your defense to show that Ms. Roosevelt consented to this procedure have clerical errors on them.
Well, I would say that maybe the top of the form, but the signature is dated the 10th, and that was the day of the procedure, so she must have given... Do you mind if I finish my response?
Let the witness
Sorry.
complete her response before it goes to the next person.
Thank you, Your Honor.
You're welcome.
It seems that again, there may be a typo on the top of the form, but it seems that the consent was taken on the 10th, as that was the date that Jesse Roosevelt signed the form, which would have been the date of the surgery in question.
It would have been the date of the second surgery, but what does the surgery date on the top of that consent form say?
I feel like I already answered this.
You did, but you just contradicted yourself. You said that the surgery occurred on the 10th, but the consent form says the surgery occurred on the 8th.
Okay. There were 2 surgeries. One was performed on the 8th. One was performed on the 10th. There was consent on the 10th as signed by Jesse Roosevelt. I already admitted that there might be a technical error on the top of the form, but that doesn't mean that the surgery for the 10th didn't happen that day and that it wasn't discussed with Jesse Roosevelt on the 10th because she signed on the 10th.
But you signed on the 8th.
You didn't ask me any questions about me signing.
I already asked you that.
You asked if I did sign.
I asked if you signed it on the 8th, because your signature is dated on the 8th.
Well, I signed a form on the 8th.
But you knew that the surgery was going to be performed on the 8th?
Well, I probably honestly looked at the date. Dates blur together sometimes. I don't know if, you always remember exactly what date it is, but I probably just briefly glanced at the top of the form, forgot it was the 10th, and wrote the 8th on there. It can happen. I'm not perfect.
Oh, and I'm not asking you to be. What I'm asking if there are at least two clerical errors on that form.
I don't know how many clerical errors.
Well, we found 2.
Okay, if you think there's 2, there's 2. I'm not admitting that there's any clerical errors. I'm not an expert in that regard.
Okay. But your signature is dated 8.
It is.
And the surgery is
Your Honor, objection. This is repetitive. The witness has already answered this question, that she signed in one place and the date is different in another
But
place.
the witness has also changed their testimony, so I think that it makes sense.
And opposing counsel clearly pointed that out and restated her fact 3 or 4 times.
Well, I think it's sufficiently established at this point that we move on and sustain the objection.
Your Honor, I move to admit that documents for the jury's
All
consideration.
right. That is plaintiff's 5. Is there any objection, Ms. Ball, to the admission of plaintiff's 5?
No, Your Honor.
All right, so admitted.
Doctor, do you feel that you explained the laparoscopic cholecystectomy procedure adequately enough to Mrs. Roosevelt?
Yes.
So you were certain that Mrs. Roosevelt was sure that she was not going to be scoped, correct?
Can you rephrase the question?
You were certain, because you approached her in the holding area, correct?
Yes.
For a scope procedure.
Well, initially it was just to do a consultation, but it eventually led to that decision based on my findings.
Yes. But you approached her in the holding area for a scope procedure, correct? She was in the holding area for a different procedure, correct?
She was.
All right, and you were certain from your conversation with her that she knew by the end of that conversation that she was no longer going to be having the procedure that she was in the holding room for.
Absolutely.
Okay. And you were certain that she also knew that you would be performing a laparoscopic cholecystectomy, correct?
Yes.
Did you describe the procedure as a laparoscopic cholecystectomy, or did you tell Ms. Roosevelt that she would be having her gallbladder removed?
Well, I used both terms, but I then explained what a laparoscopic cholecystectomy was, because I don't assume that most people understand what that means.
Great. Doctor, are you aware that Evelyn Roosevelt was a nurse, a licensed nurse?
Yes.
Okay. Doctor, you obtained we just mentioned this, you obtained her consent in the holding area. Is it your experience as a general surgeon that patients might be anxious or nervous prior to a procedure?
You'd be surprised how many patients are just anxious about coming to get a checkup. Patients are anxious a lot.
Okay. But is it your experience that they might be particularly anxious in a holding area for a procedure?
I don't see why they'd be any more anxious there than they would be anywhere else.
Okay. Did you know whether Evelyn Roosevelt had been administered any sort of drugs prior to the procedure, prior to your conversation?
Like she was on medication or was given medication in...
She was given the medication.
Yeah, she was given some medication for her pain.
Okay. And is it standard practice to have an informed consent conversation while a patient has been administered pain medication?
Absolutely. It doesn't impair them that much. Like we, heard earlier, it's like having a glass or 2 of wine. And again, a patient comes in with pain, you don't want them to be in pain. So you're going to give them a little bit of a pain shot to make sure that you reduce the pain as much as you can. And that happens all the time. Patient comes in, they want to reduce the pain, give them a pain shot, then we come in, we discuss surgery, we get their consent.
Is it, I'm confused, so this is just to, for my mind, maybe the jury's confused as well. Are you saying that the pain medicine impacts and affects all patients in the same way?
Well, no medicine impacts everybody the same way.
Okay. So did you take any sort of measures to make sure that the pain medicine wasn't having a disproportionate impact, maybe more than normal, upon Ms. Roosevelt?
Well, that comes across very clearly when you're conversing with the patient. You as a general surgeon should be able to tell the difference when someone is competent and with it enough to give consent and when they're not. And this woman was clearly able to give consent based on my training and experience.
Okay. Doctor, we now know that Ms. Roosevelt had her gallbladder removed, correct?
Yes.
Okay. And we know that because it's in the medical record, correct?
Well, it depends on where in the medical record. It was not in Dr. Thomas's history and physical.
But it's in the medical record, correct?
It's in the emergency room record.
Okay. And it's also in the physician's notes and the triage nurse notes. I didn't ask you if it was a particular doctor's notes. I asked you if it was in the medical record.
I'm just trying to clarify where in the record it was that I would have been looking at the document.
We can get to that in a couple of moments. So it's your testimony that Ms. Roosevelt, we know that she told these two other doctors, a doctor and a nurse, during admission, but it's your testimony that after she told these two doctors that she had her gallbladder removed, she did not tell you the same thing during a conversation in which you testified. You told her her gallbladder would be removed.
Objection. That question is completely confusing to our witness.
Yeah.
Do you
Confusing to the witness?
Yes. And
Overruled.
okay.
Unless it's confusing to the witness. Is it confusing to the witness?
I mean, I'm just kind of confused as to like what you're asking me, where we're going.
It just seems to me a little bit confusing that Ms. Roosevelt would have told two other hospital staff that she had had her gallbladder removed just in a normal medical history report, but when you had a conversation with her about the fact that you intended to remove her gallbladder, she didn't tell you.
She also didn't tell Dr. Thomas, and I think that was...
didn't ask her.
Dr. Thomas is her family care physician. He should be, every time you go into the doctor, they ask you about your surgical history. So clearly, she had the opportunity to tell Dr. Thomas as well, and she didn't because I looked at his H&P.
But you didn't look at the ER physician?
No, because I had the family care physician who's been seeing her for years, who should be the most aware of her situation. I had his notes. It didn't indicate gallbladder. I asked her with her daughter present. None of them said that she'd ever had her gallbladder removed.
Doctor, do you take medical notes? Do you take notes in the medical
Yes,
record?
as I mentioned, I take a dictated consultation, and then I also do post-operative notes.
Do you expect other doctors to read your notes?
It depends on the situation. That's a very big question.
So you don't expect other doctors to read your medical notes?
It depends on the situation. I can't assume every single time I've taken a note that a doctor's going to read it.
Okay. We'll come back to that.
Okay.
Do you expect the doctors that do need to read your notes to take your notes as fact?
Well, I don't know about the word fact, but if I've done a procedure and they feel the need to consult with my notes on that procedure, then they assume it to have progressed as the way I dictated it, and if not, they can come to me with questions.
On what grounds did you base your decision to attempt to remove Ms. Roosevelt's gallbladder?
Well, as I mentioned earlier, first I looked through the history and the physical that her family care physician has taken of her. That did not indicate gallbladder removal. I asked the patient if she'd ever had any gallbladder issues. She said no. When I did palpations of the right upper quadrant, she experienced some pain and tenderness. There was also a history of heartburn. There was a history of indigestion. There was cardiac chest pains. These are all indicative of gallbladder issues. As I mentioned earlier also, the bilirubin level was at the upper level of normal at the time, 1.2. And then I looked at the ultrasound report, which bolstered all of my findings.
Okay. So during your deposition and your testimony, you mentioned that the physical symptoms that you were most concerned about that she was exhibiting are, during your deposition, you described it as a mild tenderness. During your testimony, you changed that. You described it as here it is. A significant amount of pain. Is mild tenderness a significant amount of pain?
We're drawing at straws here right now. I mean, she was in pain in an area where the gallbladder is located. That was only one part of my decision to declare it urgent. As I just mentioned, there are about 5 or 6 other things that indicated there was a gallbladder issue.
Okay. And you also mentioned in your testimony that her bilirubin level, though it was high, was still in the range of normal. The upper range of normal.
Level of normal.
Okay. And
it's basically, you know, a totality of the circumstances. You're weighing a lot of different things, and to me, there was too many things that were indicating a potential gallbladder issue for me to consider this elective and to wait any longer to take it out.
it's interesting that you say that. Did Ms. Roosevelt have any of the typical symptoms of someone suffering gallbladder disease?
Yeah, she had tenderness in the upper right quadrant, as I mentioned. She had an upper level normal bilirubin level. She had chest pain. She had a history of indigestion, had a history of heartburn. Those are all things that are indicative of an abnormal gallbladder.
Okay. I would like to move for admission of, I have your deposition, and it actually says something different than what you just said. So Can I use this to refresh her memory?
Yes, you may. How do you intend? You going to hand it to her? You going to hand her deposition? Okay, go right ahead.
Okay. Could you please start at line 15?
Am I allowed to read from this document?
Well, I think at this point, has she said something different?
Yes.
She has. Okay. So you're going to remind her that she gave a deposition on such and such a date and that she was under oath. You recall all that? You recall?
I do recall giving a deposition, Your Honor.
And
Could you please read on the left column? Yeah. The other column, lines 15 through 21.
She had told me that she had had the anterior chest pain, which is quite common in gallbladder disease.
I'm sorry, that's the right column. Can you?
That's my left.
Sorry.
It's okay.
Can you please read lines 15 to 21 of that column?
Do you want me to read the lawyer's question too?
Yes, please.
Okay. Doctor, what are the typical signs or symptoms of a patient who's suffering from gallstones or gallbladder issues? Abdominal pain, nausea, vomiting, heartburn, indigestion. Sometimes the pain is in the right and mid-chest. Oftentimes it radiates into the back, not oftentimes, but sometimes.
Okay. So did Ms. Roosevelt have abdominal pain?
No, but she had pain in the upper right quadrant.
Did Ms. Roosevelt have nausea?
No, but she had heartburn and indigestion.
But she also didn't have...
And plus, you know, as was mentioned earlier, not every single patient is going to experience the same symptoms. They can vary from patient to patient. That's just what we typically see. But again, every patient's different. Every patient has a different history. I was just going off of the multitude of factors with which I was presented.
Lauren, we've got a very argumentative witness here. We're going well over time.
Okay. Doctor, you testified at your deposition that Ms. Roosevelt, if she had not had the gallbladder removal, that she more than likely would not have been subject to the complications that led to her demise. Was that your testimony?
Yeah, and I agree with that.
You still agree with that?
Yep.
Doctor, you know now that Ms. Roosevelt told the emergency physician that her gallbladder had been removed, and the emergency room physician notated in his notes, correct?
Yes.
And the nurse, the triage nurse, did the exact same thing, correct?
Yes.
Okay. Would you agree with me that medicine and patient care in a hospital setting is a collaborative effort between physicians like yourself and other members of the hospital team?
Absolutely.
Okay. When a patient comes into the hospital, you're not the first physician that sees them, correct?
Myself? Mm-hmm. Not typically, no.
Okay. And you don't live at the hospital 24/7, correct? Even
sometimes it feels like I do, yeah. But no, I have a home, luckily.
Okay. So sometimes there's a break between the first time you see a patient and the second time.
Absolutely, it happens a lot.
What do you do to know what has happened between the first time you see a patient and the second time you see a patient?
Well, it depends on the patient and the procedure, but if a doctor's gone to see them, I might ask the doctor what's happened. I might talk to the patient, look at the vital signs. It just kind of depends.
Okay, so you talk to the doctor. But the other doctors, they don't live at the hospital either, correct?
Not as far as I know.
So they go home and they're breaks and they're not always available, correct?
Yes.
So can we agree that the medical record would be the most accurate means by which you would get that information? Most reliable?
I think it depends on the situation. I think a lot of it is talking to the patient to assess what the patient's feeling.
Can we agree that the medical record is the primary means of communication by which a general surgeon, such as yourself, communicates with other members of the hospital team?
A lot of us have an ongoing communication as well.
Okay. Well, are you aware that the Joint Commission of Hospital Accreditation defines the medical record as the primary means of communication by which a general surgeon, such as yourself, communicates with other members of hospital staff?
Yes, but again, what happens in practice is a lot of us, we work together, we see each other, we communicate.
Okay. But that's not the primary means of communication, is it?
Sure.
Okay. So you would also speak to the patient?
Absolutely.
Okay. Does speaking to the patient and talking to the other doctors that are available, does that excuse not reading the entire medical record?
We don't have to read the entire medical record for every case.
Okay. Okay. So we can both agree that the medical record is the primary means of communication. And we both agree that medicine is a collaborative effort. We both agree that the gallbladder removal was in the record. But I think what you're telling me is you're trying to split hairs. You're trying to say that some portions of the medical record are more important than others. Is that what you're saying?
Again, it depends on a case. It depends on the situation.
In this case, were some portions of the medical record more important than others?
I felt that the most important things for me, in my professional opinion, were to consult with Dr. Thomas, to look at his H&P, to consult with Dr. Roberts, who did the ultrasound report, and to do an H&P of the patient myself. That was the most important thing to me.
Okay. Wouldn't you agree that the portion of Ms. Roosevelt's medical record that said she had already had her gallbladder removed was a pretty important factor in making the determination to remove her gallbladder?
Well, hindsight's 20/20. If I had known that I could have gotten that information elsewhere, I would have. But again, I felt that Dr. Thomas knew the patient well. I felt that his findings would be the most accurate because he works consistently with this patient.
So, are you saying that a doctor can rely upon other doctors to meet the standard of care? That one doctor doesn't have an individual duty to his own patient?
Well, I did, and that's why I did an H&P myself.
But you didn't have a duty to read the medical record. You felt that reading the primary caregivers was enough, that you didn't have to read the emergency room physician's notes or any other doctor's notes that indicated the scar on her abdomen.
In this situation, I felt like I upheld the standard of care by reading Dr. Thomas's findings, Dr. Roberts' report, and doing the H&P with the patient. Yes.
Laura, finish up. We're so far over the time allotted to everybody. Huh?
My time is under.
No, it's not.
You don't know how much you
We're in our 90 minutes.
Okay. Doctor, I think but looking back, we can both agree that you wish you had known that Miss Roosevelt had already had her gallbladder removed, correct?
Of course.
Okay. And I think your family would have liked to have known that too, don't you?
I mean, I can't speak for the family, but I think we're all in agreement that it would have been advantageous to know that the gallbladder had been removed.
Doctor, is death a known or accepted complication for the removal of the gallbladder that was not there?
Didn't I already answer this question?
Objection.
No, you didn't. No, this is a different question. My first question was that if death is a known and accepted consequence for gallbladder removal.
Yes.
This is different because I asked if it was a known and accepted consequence for the removal of the gallbladder that was not there.
It's never
attempted removal of the gallbladder.
I'm sorry. You said, is death a known or accepted risk in removing a gallbladder that's not there?
No, I said is death
a known or accepted complication for the removal of a gallbladder that wasn't there? Is there anything acceptable or known about this?
Well, again, death is never going to be an acceptable complication. We're trying to save lives. I don't know how to answer that question.
All right. No further questions.
All right, Ms. Bush, thank you very much. Are there additional questions for doctors? Is this Dr. Sotomayor?
Yes.
Okay. Any additional? There are none?
We would like to redirect, there is not enough time.
There are not enough, there are no more, so.
It's all supposed to be done. I haven't kept strict time, so we've got closing arguments, so let's move on.
All right. Are we then in a position to close?
We are.
Yes.
All right, very good. Are we going to, now, Professor Weiss, let me ask you this. In a civil case in here in Kentucky, we'd go defense and then plaintiff. Is that the way you're going to
Yes.
proceed? Okay, very good. So who's going to close on behalf of the defendant?
Honor, may I be dismissed?
You may step down. Thank you so much. That's excellent. That is,
Honor, may we also move that?
where you go?
Thank you so much.
You're moving the demonstrative? For what?
Out of the way. Not at all.
Oh, you want to move it out of the way. I thought you want to move it into evidence. I said, no, you can't. It's a demonstrative.
No, we don't want to do that.
The sheriff was taking care of that. Ms. Ball, are you prepared to close on behalf of the defendants?
Yes, Your Honor.
You may.
Ladies and gentlemen of the jury, think back to everything you've heard this morning. Place yourselves in the hospital with Dr. Sotomayor and Evelyn Roosevelt. Watch Dr. Sotomayor as she proceeds to treat Evelyn Roosevelt, relying on the information given to her by the patient, listening to the patient's complaints, and relying on the ultrasound that you've heard described as the gold standard, the most reliable test for determining gallbladder complications, and moving forward with the surgery to treat a patient in pain. Now picture the steady Jenga tower. Now as other players begin moving pieces, the tower is not so steady. As your turn approaches, you can use your best skill and judgment to remove the next piece and build a tower, but sometimes the odds are simply stacked against you. Plaintiff's counsel prefers to compare it as to a game of dominoes. We can do that. Different game, same result. Dr. Sotomayor is not the domino that caused the rest to fall. She was the last domino to get knocked over. This incident started on the 6th. Dr. Sotomayor did not begin treatment of the patient until the 8th. The starting pieces are still the same. The primary care physician did not provide Dr. Sotomayor with a complete history of his patient. The patient did not inform Dr. Sotomayor of her previous gallbladder surgery. And the patient's son, a registered nurse, also failed to notify Dr. Sotomayor of Evelyn Roosevelt's previous gallbladder surgery before, during, and after her hospitalization. What the Sotomayor family has had to deal with is without a doubt extremely difficult. But although sympathy is a noble virtue, it has no place in the deliberating room. The plaintiffs bear the burden of proof in this case. They must prove medical negligence by a preponderance of the evidence, which means a greater weight of evidence. The plaintiffs have alleged that Dr. Sotomayor failed to take an appropriate medical history, but Dr. Sotomayor got Evelyn Roosevelt's medical history from her primary care physician. Dr. Sotomayor asked Evelyn Roosevelt about her prior surgeries, and Dr. Sotomayor performed a thorough physical assessment of her patient. The plaintiffs also allege that Dr. Sotomayor failed to properly diagnose her condition, but Dr. Sotomayor relied on the ultrasound report, again the gold standard for determining gallbladder complications. She relied on the patient's symptoms, which included a classic example of cholecystitis, and she performed, again, a thorough physical assessment of the patient. The plaintiffs also allege that Dr. Sotomayor misread the abdominal ultrasound report, but the ultrasound is the gold standard for determining gallbladder complications, and this showed evidence that Ms. Roosevelt was suffering from gallbladder complications. The plaintiffs further allege that Dr. Sotomayor performed an unnecessary surgical procedure, but my question to you is, when did it become unnecessary for a doctor to try to alleviate her patient's pain quickly? The patient was in pain and the infection could get worse. And Dr. Ginsburg, who's performed countless cholecystectomies, has stated that this was an urgent surgery and that she would operate fairly quickly on this patient. The plaintiffs further allege that Dr. Sotomayor failed to delay an elective surgical procedure while Ms. Roosevelt was on several medications that would thin her blood. But this surgery was not elective, it was urgent. and Dr. Sotomayor had to carefully weigh the risk between taking a patient with a cardiac history off of her heart medications, which were protecting her from a risk of heart attack, with the risk of increased bleeding with the surgery. And in 2001, these medications that the patient were on were not viewed as a risk undergoing surgery. Dr. Ginsburg stated that she has performed a vascular surgery on Plavix, and Lovenox is still not a significant risk. In fact, at St. Jefferson, patients are mandated to be on Lovenox before undergoing surgery. The plaintiffs further allege that Dr. Sotomayor failed to timely recognize and diagnose post-operative complications. But Dr. Sotomayor made daily rounds and progress notes of the patient. She even kept in contact with Dr. Oscar Meyer, her partner, when she was not on call at the hospital. You are about to be instructed on the standard of care, which is the degree of care, skill, and judgment which a reasonable doctor practicing medicine would exercise in the same or similar circumstances, having due regard for the state of medical science at the time. This standard is within the special knowledge of experts in the field. It is not common knowledge. The plaintiff's own expert has defined the standard as what an ordinary doctor would do in the circumstances. The medical review panel, a group of doctors, found that Dr. Sotomayor had met this standard. Plaintiff's expert, Dr. Scalia, disagrees, and actually he habitually disagrees. He disagrees enough to account for 25% of his income on a given year. He disagrees, but yet he has been sued for medical malpractice not once, but twice in the past. He disagrees, but he performs very few surgeries in this community nowadays. Should he decide the degree of care, skill, and judgment that a reasonable doctor in the same or similar circumstances? Or should Dr. Ginsburg, a surgeon who has performed around 2,500 cholecystectomies with little complications, decide the standard? This decision is in your hands. Ladies and gentlemen, you decide this case. It is your collective memory of the facts as applied to the trial judge's instructions on the law that controls the outcome. You will be instructed that it's your duty to find against the plaintiff if they have not met their burden of proof. The plaintiffs have not presented you the convincing evidence that they promised you at the beginning of this trial. Dr. Sotomayor never fell below the standard of care and her devoted treatment of Evelyn Roosevelt.
Thank you, Ms. Ball. Let's see. Mr. O'Brien, are
Yes,
you
sir.
prepared to close on behalf of the plaintiffs?
I am prepared to close on behalf of the
You may.
I'm in the unenviable position of being the second closer.
Are you appealing to the timekeeper already?
Would the judge please keep that in mind?
Believe me, Patrick, we're all looking forward to it.
Mr. O'Brien, you may close.
Ladies and gentlemen, we heard a lot about the gold standard here today. Abdominal ultrasound is the gold standard. You know what Dr. Sotomayor did with that gold standard? He treated it like it was a piece of lead. He treated it like it was a piece of lead because you'll see when you take that ultrasound report back into the jury room with you that all over that ultrasound report, nothing in the ultrasound report, I want you to look at it carefully, said that there was a gallbladder there. Right? The first words of the impression, which is the only part he thought he had to read, say abnormal gallbladder region. I want you to draw a difference between the two. Right? The gallbladder is the gallbladder. The region is the area where the gallbladder is. There was an abnormal gallbladder region. Okay? Now, I want to bring just a little clarity and reason to this stage for you ladies and gentlemen. I was the first attorney who spoke to you this morning, and I told you what the evidence would show. The defense argues that we didn't show you what we said we did. Let's talk about that for a second. I told you, I also asked you not to check your common sense at the door. And here's why I think we proved everything that I told you we did. Because this is a civil case. This is not a legal case. We all watch TV shows. We know that on TV or on a show like Law & Order, when they go to court, the standard is beyond a reasonable doubt. It means there can be no doubt. Well, that's not the standard here. The standard here is a preponderance of the evidence, which means we just have to show ours a little bit more than theirs. And I'm not submitting to you that we just did a little bit more. That's not what I'm suggesting to you at all. I'm telling you we went way beyond that. I told you that the evidence would show that Evelyn Roosevelt did not have a gallbladder when she came into the hospital on November 6, 2001. She didn't. I didn't lie to you about that. I told you that at the time Dr. Sotomayor performed that procedure, that Evelyn was susceptible to bleeding because of the medication she was on. Now you know that she was. I didn't lie about that either. But you also know that Dr. Sotomayor knew that, and that he, despite knowing she was susceptible to internal bleeding, went ahead with the procedure anyway. I didn't lie to you about that. I told you that the unnecessary procedure Dr. Sotomayor performed on Evelyn set in motion a series of events that led to her death in that hospital bed. And Dr. Sotomayor admitted that for you here today. I didn't lie about that. I told you that Dr. Sotomayor had all the information he needed to merely suspect that Evelyn had a previous gallbladder procedure. I don't think anyone sitting here in this courtroom, after all the testimony we've heard, could very well say that he didn't have enough information in front of him to merely suspect that Evelyn had a gallbladder procedure. This goes way beyond mere suspicion, ladies and gentlemen. Let's talk about what Dr. Sotomayor had right in front of her. She had everything she needed right there in black and white print, and we showed you that. She had the record of the ER doctor's entry, she had the record of the triage nurse's entry, and both of those entries clearly indicated that Evelyn Roosevelt did not have a gallbladder. Dr. Sotomayor had a patient with a scar, and that should have indicated to her that there had been an abdominal procedure. Now that single scar at the belly button, which is made by this, it's a trocar, ladies and gentlemen. That single scar at the belly button, that maybe wouldn't indicate a laparoscopic cholecystectomy. But we know those weren't the only scars that Evelyn Roosevelt had, were they? She had 2 other scars on her right upper quadrant, and that would have clearly indicated a laparoscopic cholecystectomy. Had Dr. Sotomayor done a proper physical examination and seen the first one, she would have been clued and cued in to look around and do an adequate physical examination of Evelyn Roosevelt. Speaking of that adequate physical examination, he says he did one. Did he? We heard testimony from their expert who said, you know, sometimes you can see the scar, sometimes you can't, sometimes it's invisible. Was that scar invisible? I don't think it was, because the other doctor who performed the physical on Evelyn Roosevelt, he saw that scar, didn't he? So that scar was not invisible. You don't have to pay attention to that. Again, I told you, don't check your common sense at the door. That other doctor noted it, and she should have seen it too. Now, she also had the ultrasound report, which we've heard over and over again was the gold standard. And like I said, when you get back in the jury room and you look at that ultrasound report, you see if Dr. Sotomayor treated it like the gold standard, if he treated it like a piece of lead. Because what you're going to see is language like possibly containing stones, assuming the gallbladder is still present. Gallbladder region. The report never said the gallbladder was there. Never. Not once. Now, when you add all those things up, ladies and gentlemen, the sum is greater than the parts. It just is. You can't just look at everything in a vacuum or in the void. The sum is greater than the parts here. Strike 1, the medical record. Strike 2, the ultrasound with the radiologist who couldn't even say that he saw a gallbladder. Strike 3, the doctor who didn't see a scar that another doctor noted. 1, 2, 3, out. She's out. Let's talk about their evidence, folks. What is it? In every case where I come into a courtroom and I argue on behalf of a family like this one, and I go against a defense team like this one, if they don't have a good case, they've got a particularly interesting defense that they want to mount. You know what they do? They try to confuse the jury. They always try to confuse the jury. And the best analogy I can think of, you got to excuse me, I'm from Bardstown, Kentucky, I'm a little country, but the best analogy I can think of is that what they do is they come in here with a gunny sack full of alley cats and they dump it on the floor. And they're hoping and they're praying that you're going to pay attention to all these cats running around here in the courtroom and not pay attention to the facts and the important facts. Now, let's talk about those cats. The scar. She says she didn't see it. Well, we know that that cat goes back in the gunny sack because the other doctor saw it, don't we? We also know that they talked about the consent. That's another cat they try to confuse you with. They talked about the consent. And you heard Dr. Sotomayor agree and stipulate right here on this stand under oath that it was full of clerical errors. There were clerical errors all over that thing. Only one place on that consent form that Evelyn Roosevelt signed herself did it say laparoscopic cholecystectomy. And oh, by the way, it was one lined out, unlike the other pages that said gastroscopy, and there was no initials and there was no date. So we don't know if Dr. Sotomayor did that before or after the surgery, do we? And now we'll never know. And we don't know what was going on with that other consent form because there were different dates all over it. It's another cat back in the gunny sack for you, ladies and gentlemen. They put a lot of blame on people. They put a lot of blame on Carrie Roosevelt. They put a lot of blame on Jessie Roosevelt for not being more forceful with the doctor and telling the doctor that they thought their mother had her gallbladder out. Well, guess what? They didn't have the duty to inform that doctor of that. You know who did have a duty? Evelyn Roosevelt. But we heard testimony that Evelyn Roosevelt was under the influence of pain medication at the time that he went and talked to her. Now, you have to suspend your common sense completely to believe that an LPN who already told 2 medical professionals that she had her gallbladder out would understand while she was on pain medication, or 2 glasses of wine if you want to put it that way, that you have to suspend disbelief to believe that she wouldn't have told the doctor that if he explained it to her adequately. Did he really explain it to her adequately? I don't think she did. It's another cat back in the gunny sack. Talked about those blood thinners. They tell you that in 2001, it wasn't the standard of care during a procedure to remove a patient from blood thinners to prevent bleeding. Well, guess what? They took her off of those blood thinners after the procedure when the wound was oozing and bleeding and they couldn't make it stop. And they took her off of those blood thinners before the second procedure, too. They talked about a gallbladder remnant. Talked about how they went in for the gallbladder remnant. Well, that remnant wasn't very important, was it? Because they didn't take it out the first time they went in and saw it. It's another cat back in the gunny sack. Now, on that ultrasound report for just a second, the words assuming the gallbladder is still there. That's really important. I want you to focus on that. Because I don't know about you, but when I hear the word assume, it means someone's telling me they don't know what's going on. And it should mean the same thing to you. It's plain English. Don't be confused. Don't think about what's it mean in medical jargon. Think about what it means in plain English. All right? I'll tell you a little story. I was in the United States Navy for 5 years. I worked on the flight deck with an aircraft carrier. I was one of those guys that wore the yellow shirt and I had the yellow sticks and I'd wave my arms around and the jet planes would take off from the flight deck. I had another job. Where I would stand up at the front of the landing area next to where the planes came in. The goal when the plane lands is to land in the middle of 4 wires and catch them with a tail hook on the plane. Now when that pilot hits the deck and his wheels hit the deck, he has to throttle his engines all the way up because he has to have enough juice to get off the deck again if he didn't catch the wire. It's not a given that that wire is going to be underneath him in the place where he lands. But he can't make the assumption that he caught the wire. He can't do that, and Dr. Sotomayor shouldn't have made the assumption that the gallbladder was there. He can't make the assumption, the pilot can't, because he's got an air crew and their lives to worry about. And if he makes that assumption and he's wrong, guess what? People die. And that's what happened here. Now, like I said, I put all those cats in the gunny sack for you, but how does that make sense? It makes sense because they want you to pay attention to those cats, but not the 600-pound line sitting right here beside them. They don't want you to pay attention to that line. What's the line? The line is the medical report. He tries to tell you, she tries to tell you, that she didn't have a duty to look at that medical report. They made it seem like it wasn't really important. Well, guess who it was important to? It was important to Evelyn Roosevelt and her family, wasn't it? It sure was. Now, they know darn good and well, and I know darn good and well, and you folks know darn good and well, that she should have stopped what she was doing at several points during this procedure. She should have stopped. She should have said, hold up, tilt. You know, something's rotten in the state of Denmark. Something is wrong here, and I don't really know what's going on, and I need to do a little more investigation. But she didn't do that, did she? And why didn't she do that? Because she was in a hurry. You heard Jesse Roosevelt's testimony. She was in a hurry. She wanted to go home, and she didn't want to come back. Now, my wife just completed a year of general surgery at the University of Louisville, a residency, and I can tell you she probably slept a total of 5 hours every night over the last year. And she didn't want to get up out of bed when the pages were answered, and she didn't want to go home from a patient she'd already seen knowing that she would have to come back, but she did it. Guess why she did it? Because that's part of the gig. You have the duty to take care of your patients in the way that you're supposed to. You have a duty to provide them with adequate care. There's a payoff for it at the end when they get out of the residency. Let's look at the experts. I'm almost done here, but I think the experts are pretty important. Let's look at their expert. I told you in the beginning to look at the experts, listen to what they say, but also to think about who they are and what their relationships are to the parties. This lady, Dr. Ginsburg, she knows Dr. Sotomayor. She's trained with him, side by side, at the same institution for at least 2 years. All right? Is that fair? I got on Google last night and looked this up. There are 18,000 general surgeons practicing in the United States of America today. We went out and got someone from Harvard. We went out and got someone who was fair and impartial and didn't know the party. They didn't do that, did they? No. They went out and got good old Dr. Ginsburg, a friend, a colleague. They could have gotten anyone in the United States. They could have gotten 17,999 other general surgeons to come in here and tell you that what Dr. Sotomayor did was not below the standard of care. They could have. I don't think they could have. I think they went out there and got the only person in the world who would have come in here and told you that what Dr. Sotomayor did was not below the standard of care. I think they went out there and they got the only person, the only general surgeon in the United States of America who would have come in here and tried to pull her out of the fire. Our client was an LPN. What if we had gone out and gotten a general surgeon who worked with our client for 10 years and came in here and told you that what Dr. Sotomayor did was below the standard of care? Would you have thought that was fair? I don't think you would have thought that was fair. There have been suggestions, and there was a suggestion here on defense counsel's closing argument. This is all about sympathy. Ladies and gentlemen, Evelyn Roosevelt's family isn't here for your sympathy. When you read those instructions tell you not to use your sympathy. I'm telling you not to use your sympathy. The judge will tell you not to use your sympathy. All right? Because it's not fair that you do that. It's not fair that you find for our client on sympathy, but it's also, at the same time, it's not fair that you forgive Dr. Sotomayor based on sympathy. It's just not. Forgiveness and pity, that's for God. These people are here for justice. And if you could find for Evelyn Roosevelt and for Evelyn Roosevelt's family and have Evelyn Roosevelt come back to life and walk through those doors, she and her family would walk out of here arm in arm and go have Thanksgiving dinner next week, and they'd be just as happy with that. But that's not possible. These people are here for justice, and that's the system we have. That's the system we have in the United States of America, and it's a great system, and that's what these people chose to use. And we have that system for a reason. If you look back in our history, people didn't used to handle their differences in this way. You know, we're all here in Kentucky. We're all here to the Hatfields and McCoys. Those days are long gone. You got to come in here in a court of law and argue your case and make your points and have a jury of your peers decide. This is the system we have. This is the system these people chose to use. This is the system they chose to use. Finally, I'll leave you with this. This case, it extends well beyond Evelyn Roosevelt and Sidney Sotomayor. Thomas Jefferson once said that the wisdom of our sages and the blood of our heroes have been devoted to the attainment of trial by jury. Trial by jury is a bright constellation which leads to peace, liberty, and safety. Safety, ladies and gentlemen. Now, I just told you that this goes way beyond these two people. And it does. And why is that? Because if you decide that what Dr. Sotomayor did was below the standard of care, that his conduct fell below that standard, the word will go out from this courthouse. You better believe that it will at the very least go out to all the other surgeons in this jurisdiction and maybe to every surgeon in every hospital in the United States of America. And those surgeons will know, by God, that they better be looking into a patient's medical record. They better be looking at the entries from other board-certified physicians. And they'll know that they better do an adequate physical exam, and they at the very least better see a scar that another doctor saw. They'll know that they better do more to the gold standard ultrasound report than give it a quick glance, which is exactly what he did. And maybe, just maybe, the next Evelyn Roosevelt who comes into a hospital and they want to remove an organ that's already been removed, maybe, just maybe, the next Evelyn Roosevelt won't have to lay in a hospital bed and die, scared, confused, and in pain, and not knowing what was going on with it. Thank you very much.
All right, Mr. O'Brien, thank you very much. Case is ready to be submitted
All
to
right,
the jury.
Patrick.
What am I supposed to, I mean, you mean, I'm
Almost.
trying to do the expedited version.
All right, yeah.
Patrick, he wasn't that
Patrick,
good.
what is your last name, Patrick?
Just pretend he wasn't that good.
Okay. Markey.
Markey? Okay. I was about to call him Dr. Scalia.
Play pretend, you
Dr.
know.
Scalia. Yeah, very good closing. Mark, is it, what is his last name?
Markey.
Markey.
M-A-R-K-E-Y.
All right, Mr. Markey, you may proceed.
Thank you, Your Honor. Ladies and gentlemen of the jury, I want to thank you for your service. It's greatly appreciated. It's a difficult burden, but it's an important societal function. It helps this community to operate and exist in an orderly manner, and I thank you for your time. You've heard lots of evidence. You've heard lots of testimony. I don't intend to just re-recite that for you. Instead, I intend to tell you what that evidence means. The defense would have you believe that this is a complicated case, but it is not. This case requires you to ask yourself, is death a known and accepted complication of having a gallbladder removal surgery for a gallbladder that has already been removed? Here, the failure to check simple records resulted in an unnecessary elective surgery and death. Evelyn went to the ER with chest pains, and she died from complications that occurred from a gallbladder surgery to remove a gallbladder that wasn't there. Does that make sense? In America, we expect our healthcare providers to make us better, not worse. Dr. Sotomayor unnecessarily rushed this elective surgery, and that led to this tragic death. Dr. Sotomayor failed to do her due diligence. This death was tragic and unnecessary. It was preventable. The simple check of the emergency room physician's notes would have shown clearly gallbladder had been removed. We're not asking for an extra step. And that's very important to understand. No, we're not saying here the doctor should have checked every hospital record. We didn't ask that. We're not suggesting that. You heard Dr. Scalia testify. The standard of care. What's expected for a normal surgeon? Standard care, not extraordinary. The standard was to check the emergency physician room's notes. Why didn't he? Why didn't she? Why? That's what we're left asking ourselves. Better yet, why did the doctor not wait until the medications had been stopped? You heard testimony from Dr. Scalia. This patient was on 4 medications that posed the very real and obvious risk of complications related to bleeding after the surgery. And there's 2 issues. Number 1, elective. Dr. Scalia clearly said that means it didn't have to happen at that time. It could have been treated with pain medications. Number 2, there was no reason to not consult with the physician and stop this medication. Those risks could have been prevented. You heard Dr. Scalia testify. Her platelets were paralyzed. That means if she started to bleed, her body couldn't fight back. And that's exactly what happened. This was an unnecessary risk. Why? Why take that risk? I'll tell you why. You heard testimony. The deposition of Jesse Roosevelt. She, Dr. Sotomayor, was in a hurry. Dr. Sotomayor was in a hurry to get home. Couldn't perform simple record checks. You know who else wanted to go home? Evelyn Roosevelt. She wanted to go home. But she wanted to go home well, healthy. She wanted to go home to continue being the caring and loving mother that she was. That didn't happen. Evelyn Roosevelt's home is in a cemetery. Even in the absence of the record check, even in the absence of waiting to perform this elective surgery until the platelet inhibitors had been stopped, this all could have been prevented by the doctor simply noticing the scar. The doctor taking the action that the doctor was trained to do. Conducting the physical. There's the scar. Gee, what does this mean? What explanation can be given for this omission other than being in a hurry? I'll tell you what the other explanation is. Number 1, this doctor was in a hurry. Number 2, this doctor is grossly incompetent. Neither one of them is a good explanation. The defense would have you focus so strongly on the fact that neither Jesse Roosevelt, who's deceased, and Evelyn Roosevelt, who's also deceased, did not supposedly specifically tell the doctor that the gallbladder had already been removed. Well, let's talk about that for a minute. Sadly, Jesse Roosevelt couldn't be here today to sit in that chair and explain to you why. That's because she's dead. You heard the deposition read. She talked to Dr. Thomas about it. Is it the patient's child's responsibility to be sure to give a full medical history to every doctor she sees? That answer is obvious. You heard testimony. Why didn't Evelyn Roosevelt tell the doctor? She couldn't sit here today. She couldn't explain that to you. because of this doctor. But let's talk about that for a minute. You heard Dr. Scalia testify. Standard of care. A normal surgeon, not an extraordinary surgeon, a normal surgeon would not approach a patient who's prepared for another surgery, I might add, and say, hey, let's have a different surgery. Are you ready for that? We heard testimony she was on medication. We heard testimony from Dr. Scalia. She was afraid. This is normal. Fear, anxiety. Anyone who goes and is getting ready to be operated on, let's remember, what's an operation? We're talking about getting cut, okay? Anyone's going to be fearful. Anyone's going to be anxious. Couple that with medication. It was absolutely ludicrous. It was insulting that this doctor would do that. Some hospitals, you heard that testimony, they will not, it's their policy, they will not allow consent in the holding area. Why is that? That's pretty obvious. We have either a doctor in a hurry or we have a doctor who's grossly incompetent. Which one is it? The incision would have been in the same area. How could the doctor have not seen it? The original operation took place in 1991 with larger instruments. It should have been more readily apparent. How could the doctor not see it? And how could this doctor expect that the responsibility is on the patient? The responsibility is on the patient's child. It's not. It's the doctor's responsibility. This is a simple record check. Medicine is a collaborative effort, and the surgeon is the team captain. But this team captain was too good or in too big of a hurry to take a few extra moments to read the notes of those lesser teammates. Does this make sense? Can we really put much stock in this so-called consent? A fearful patient, an anxious patient? We'll never know what thoughts were going through her mind as she's laying there, prone, waiting to have surgery. Thoughts of her own mortality, perhaps? Thoughts of things done? Thoughts of things left undone? We'll never know. But we do know that this doctor expected her to be 100% sharp and responsible. Frankly, that's insulting. We heard testimony about this medical review board report. How independent was that when it was run by one of her colleagues, Dr. Ginsburg? And should we really take how credible is a board in which one of the physicians who sat there and testified, Dr. Ginsburg, said that, oh, you know, minimal record checks, that's fine. Is that the kind of oversight that we want for our medical care? Let's talk briefly about jury instructions. You, the jury, have to find, in order for Evelyn to win, that the defendant, Dr. Sotomayor, was negligent and that such negligence was a proximate cause of the plaintiff's death. Let's talk more about that. This is a case of medical negligence, in other words, medical malpractice. And the only issue is if Evelyn was damaged or injured by the negligence of the defendant. You heard Dr. Scalia testify. It's malpractice for a surgeon to not act the way a normal surgeon would do under similar conditions. And it's our job to prove that. You're also required to find, in order to render a verdict in favor of Evelyn, that the doctor's negligence was a substantial factor in producing the death of Evelyn. It doesn't have to be the sole cause. It just has to be a cause. An important, again, substantial factor, an important or significant factor. That's not necessarily the only factor leading to the plaintiff's injury. The burden of proof, this is not a criminal case. We do not have the hefty, beyond a reasonable doubt standard. You just have to find that it is more likely than not that there's a greater than 50% chance that things that we presented in our case are true. You are not bound by the medical review panel's judgment. Make no mistake, Dr. Sotomayor believes that the complications that occurred after the unnecessary elective surgery set forth a series of events that led to the death of Evelyn Roosevelt. This was the domino effect that Dr. Scalia testified. Clearly that was a cause of the plaintiff's death. Clearly the failure to know there was no gallbladder and thus not perform the unnecessary elective surgery was a cause of Evelyn's death. Evelyn may have been 75 years old, but she was full of life. A caring mother, a vibrant member of this community, and ladies and gentlemen, a simple failure to check records has led to the loss of that vibrant member of this community. The doctor failed to notice an obvious scar. There can be no doubt that the doctor failed to do what a normal surgeon would do under similar conditions. What a privilege it's been to represent this family, such a caring family, such a loving family. What a privilege it is to try and help this family feel just a little bit better about this tragedy that's occurred. The loss of their vibrant, caring mother who died far too soon. Ladies and gentlemen, you have the opportunity to render a verdict in favor of Evelyn. You have the opportunity to render a verdict for the right reason. Because in America, we expect our healthcare providers to not be in a hurry. We expect them to care. We expect them to help us heal. I want to thank you again. I'm going to close with this. From the very first time I reviewed this case, I was struck with an image. And as I stand here today, that image is in my mind. My mind drifts right now. I can see it in front of me. I'm thinking of that iconic genius, creator of Americana imaging. I'm thinking of Norman Rockwell. But when I think of medical care in this country, the first thing I think of is that famous cover of the Saturday Post. The child has come into the doctor's office. She's holding up the doll. The doctor is there, dutifully, with a serious look of care and concern, checking the vitals of that doll. The child, sorrowful, scared, but that doctor is a bastion of strength, of hope. The child has come there believing things will get better. This is the type of care that we expect in America. That's the ultimate illustration of our trust, our belief that doctors can help us heal. The caring and sensitive doctor who's trying to treat the whole patient, who's not in a hurry. Evelyn Roosevelt believed in that vision. She was a nurse. She believed in the medical profession, and sadly and tragically, she was let down. All because of an unnecessary elective surgery. Please make the right decision. Thank you.
Thank you very much. Multi-talented the multi-talented Dr. Scalia gets up and closes too. Awesome. That is great.
Any comments?
Oh, I've got all kinds of stuff. I got all kinds of
all right
things. But let me just share something real quick, okay? I have this Facebook. They get on me. My colleagues get on me. But what do they know? I have a Facebook page, and I'll put some comments on there from time to time, and I want to share with you what I put on there first thing this morning, if it'll come up. Okay. I wrote about 3 hours ago that, yeah, 3 hours. It's a trial. It's a trial. I mean, what are you going to do? You got to try the case, right? At this moment, I have the pleasure of presiding at a law school trial advocacy final in my courtroom. My friend and one of the finest trial lawyers in the history of the Commonwealth, Gary Weiss, is their professor of law, and it shows. These students are doing an outstanding job. Honestly, there is very little difference between this and some of what I see in a real trial. It speaks to the work Gary has done with these students. In a mock trial, the students play the witnesses as well, including the expert witnesses. These witnesses are so good, I forget they're acting, which I do. It's a good Saturday rather. It's a good Saturday morning. I'm reminded of why I fell in love with the law. That's what I wrote. All right, that's on Facebook. You guys are outstanding. I mean, really. And I'm not trying to just get your grade up. Although I think your grade should be very high.
Professor Weiss.
Okay? Let's just put it this way. If they don't get all A's, then you've got to give out some harsh grades to some real lawyers that try cases in here.
It's on the record.
Yeah, well, it's on the record. That's right. You guys, I mean, seriously, this is really outstanding work, and it really speaks to what Professor Weiss has done with you, because you know, I try more cases than anybody. He may have told you, but I'll brag on myself for a second. I see more trials than anybody in the Commonwealth. I try more cases. So I see a lot of lawyers, a lot of trials. I'm not pretending to be able to do it, but I've seen a lot. I know what's bad. I know what's good. I know what's great. This is really outstanding, all of you. Fantastic. I'm very impressed. And like I said, there was one point where I sustained an objection. I think it was the question calls for speculation. And I was slow on it because I looked at, I don't know who it was, but I looked at it and said, well, why would you ask that question? But I really thought, for a second, I forgot. I thought I was dealing with lawyers in here in a real trial because you guys are so good. I looked and said, well, why in the world would you ask that? And then I remembered your students. Okay, that's how good you are. Really, I got out of my element for a second. But outstanding work. Professor Weiss, nice job.
All right, I'm going to send each of you an analysis, good, bad, and indifferent. There was some bad, there was some good, there was some great. But the only thing I'm going to say now struck me. I was hoping that I would be pleased with all of you, but I can honestly tell you that I'm proud of them. Okay. We've got jurors here that want to go to lunch, but also deliberate. So we can deliberate at lunch.
Can I say one thing as a juror?
Yeah.
I would say bravo to all of you. It was just wonderful. It really was. I totally forgot this was all, you know, make-believe too, and really got into it. And I think you all did an outstanding job.
Thank you. Thank you very much. You all want to say?
I second that.
Yeah.
I agree.
Yeah, it shows what it shows is I said I would just judge effort. Number one, obviously there was a tremendous amount of effort put in here. Okay, so nobody's going to get a D. That's on the record. But there's some real talent in here.
Indeed.
What hopefully, I mean, you all got up this morning and you were nervous. And this is what it is to be a trial lawyer. It's a great calling. From what I saw in here, every one of you could be a really successful trial lawyer. What pleased me the most was that the stuff that I taught you, you obviously listened to. You learned and you did it. Little things that jurors wouldn't pick up on. Like one of the questions was, tell me about that. I mean, just these small tidbits. So once again, I'm really proud of all of you. All right, we're going to go eat lunch. We have one more trial. You're going to retire.
I'm sorry we went over
We'll see. I might do it. You got a new group coming in? Let me go off.
Yeah, we got another group coming in.